So Fahd, are the participants, is it possible for the participant to type in the questions that I can read? I guess we lost Fahd. Oh, here's
Yes,
Kate.
so we
Yeah.
can do it.
Yeah, so I will ask him to, at the beginning, I will ask him to type questions at the beginning of the segment, and then I'm gonna search through, and maybe at the end we have 15 minutes, so maybe I'll read one or two. Sometimes there are questions that are along the same theme, right? So we'll just group them in two questions. Is that okay?
Okay.
Yeah.
Kate, good morning. Thank you for joining us.
Hi, Kate.
Good evening.
How are you?
Hi. Good to see
you. Welcome.
Kate, I just want to be sure that I know that you have so many leadership roles, right? And my question to you is, are you also president of the Australasian Neurosurgical Society? No, okay, I'm sorry.
No.
I just want to have it right.
Est-ce que tout le monde est là maintenant?
Pour la première session.
On a tout le monde pour la première session, oui. Je pense que...
On va vérifier. Tu as vérifié, Isabelle?
Oui, tout le monde est là.
OK.
Donc, ça va.
Mais il n'est pas... Attends, il est quelle heure là? Il est 53.
Ouais, so 7 minutes, et puis on peut commencer.
7 minutes, on attend, comme ça on commence directement à la bonne heure, c'est mieux, non?
Je pense.
Ouais.
Yeah, yes, please, because it's disseminated by YouTube and others,
Okay.
so we need to start at the time.
Ouais.
6 minutes, we can discuss about time. It's
Good
already
morning.
done.
Professor,
Hi,
good morning.
How are
Good
you?
morning, Najia. Good morning, Isabelle. Good
Hi,
morning,
Ustad.
Souad. It's
How are
a great
you?
pleasure to see all of you.
Merci.
Thank you, sir. Thank you, sir.
Wow.
It's a lot of
the ladies leaders in neurosurgery.
Bonjour, merci, monsieur.
Merci à vous, madame aussi. Merci à vous toutes. Toutes et tous.
We're definitely workers.
She speaks French time by time.
Very nice to see all of you. Vous êtes, how Isabelle to say in English, vous êtes radieuse.
We are radiant.
Yes.
Radiant.
Very good.
Lynn, how are you, Lynn?
Lynn, I
Hello,
didn't see you. How are you?
hello everyone. Souad,
How are
Nadia,
you?
Isabelle, Nelci.
Fine. Welcome, Lynn. Welcome.
Nice to see you
Our
from the
poetess, you know that Lynn, she's a great poetess, and I love that you what you post in Facebook. It's really amazing. Congratulations.
It's a sort of what's that? Relaxation and distraction at the same time.
Yeah,
Yeah.
sure. We need something like this for our
Peace of mind.
specialty. It's so hard, so we need something the way to be more relaxed.
Yeah. Thank you.
Okay.
So in the way of disclosure, I had disclosed to Dr. El Abbadi and Souad Bakhti that unfortunately I need to get off the platform and go to the operating room, take care of some patients. So I apologize, and it's not disrespectful, but when Dr. El Abbadi had and I started looking into this today, it looked like it was the best date for everyone. So I apologize if I'm not present for the entire symposium, but I will definitely, when I'm done with my day, I will definitely listen to all the other beautiful talks after the first segment.
Sorry, no problem, my dear Isabelle. We understand your situation.
There's no day
Don't worry.
It is good for everyone, right?
Don't worry. We know with the COVID, we cannot have a a schedule, normal schedule. We are always waving with this with our schedules. We are waiting for the Dr. Qureshi. Dr. Qureshi, tu peux le relancer?
Hi again, everyone. The leaders of neurosurgery worldwide. I'm Fahd Derkaoui, and I will try to manage technically this webinar with a great team. So we will go online in 2 minutes. So just I ask. Yes, we are trying to reach Professor Qureshi, the president of CAANS. And now we are online on YouTube, and I will open in 15 seconds to attendees the session the webinar in order to join us before starting at on time. Okay. Thank you. Non, c'est trop tard. Trop tard. Trop tard. Trop tard.
Est-ce que les... Souad, comment vas-tu? Tu m'entends?
Écoutez, oui, beaucoup mieux. Bah, puisque je suis avec vous, ça veut dire que ça va beaucoup mieux.
Vraiment, je suis très content et nous sommes très, très contents de t'avoir avec nous. Hein.
Je sais, moi aussi. Là, j'y croyais
beaucoup.
pas et j'y suis, ça va.
Inch'Allah, tout ira bien.
Inch'Allah.
On est à le temps, midi. Il faut respecter le temps. Le temps de parler. Le temps de parler, le temps que vous parlez, et puis après.
Le temps que je parle.
Voilà, voilà. So let's start this amazing symposium. Dear honorable faculty and attendees, good morning in New York and Sao Paulo, good evening in Tokyo and Melbourne, and good afternoon if you are in Europe or Africa. Ramadan Kareem for those who observe it. We hope for you health and happiness for all human beings. Welcome to the joint symposium of the two very active committees of the World Federation, the joint symposium of WFNS Women in Neurosurgery Committee and WFNS Education and Training Committee. I am Fahd Derkaoui. I am honored to be the coordinator of today's symposium with a great team of leaders in worldwide neurosurgery. Well, good morning, Professor Isabelle Germano, Chair of WFNS Education and Training Committee, and Professor Souad Bakhti, Chair of WEN Committee, and of course, the Director of the course, the Assistant Treasurer of WFNS, the Treasurer of the CAANS, and the President of the Pan-Arab Neurosurgical Society, Professor Najia El Abbadi. Thanks to all faculty from the 50 continents who accept to share their knowledge and their vision with their colleagues around the world. Professor Abbadi, you have the mic to start officially the symposium.
Thank you, dear Fahd. It's enormous work that you are doing for this webinar and this symposium and course. So, Mr. WFNS Honorary President, Mr. President of CAANS, he is not here, but he is here, Mahmoud. It's good, he's connected right now. So, my dear friend, my dear Professor Isabelle Germano, Chairman of the Training and Education Committee, my dear Souad, Professor Souad Bakhti, the Chairman of WIN Committee, dear guests, dear colleagues, and dear friends. I would like to give a warm welcome to everyone, especially to our guests oversized from Australia, from Asia, from America, from USA and Latin America. And I'm delighted to welcome you to this event, which is especially dedicated to women in neurosurgery and women's leadership in WFNS. It's a wonderful experience for us that we really want to defend and commit to. Human contacts, as you know, are so important, and we want to feel that what the others express or say. We want to understand their emotions, their stupefactions, their silence, and so on. This is in the nature of human being, a purpose of humankind to fulfill, and the reason why relationships are so important. The physical presence of people in a meeting is important, but nowadays, with the actual pandemic, we don't have much of choice. This virus is changing our lifestyle, and we have to adapt. We have to adjust to this new situation, even if I believe most of us are not very happy with it, but this is the destiny. So we need to move on, and we have and must continue to try to have academic exchanges between us in the best conditions, given these circumstances. This is the reason why we have decided to do some more than now 15 months ago. This is the reason why we decided to do it virtually, as we did for more than 15 months. So we know, all of us, that the number of the women in the medical field have increased around the world. Neurosurgery has been, unfortunately, a very recurrent theme amongst surgical disciplines. Neurosurgery is still the least equitable, and the rate of increase in females' legs is way behind other surgical disciplines, such as general surgery. The route to becoming a successful neurosurgeon is long, with many barriers for any candidate from any country and to overcome. Neurosurgeons in the general must follow a very busy work schedule. Our friend Isabelle Germano just tell us that she's really very busy, and she will go to a operating room just after her session. And of course, it's being a call to respond to emergencies at night, on weekends, even sometimes during holidays. And the time it takes to become a full, well-trained neurosurgeon is a long, also very, very long. This may be challenging, especially for women who are trying to balance a career with family obligations. I conclude by saying that our conference is a step toward developing a framework that we desperately need in order to raise the number of women leaders around the world. I wish you us all a very and a productive symposium, and thank you again for all the speakers, moderators, and also for the attendees. I will give maybe our president of WFNS. He apologized because he had a commitment because there is a time zone. Actually, we are 2 hours difference, so he will join us in the end of this symposium to give us some final remarks. So I will give the floor to our president of CAANS. Please, Moody is here.
Yes, I'm
Are
here,
you
Najia.
here?
Yes, I'm here, Najia.
So thank you so much to join us to this symposium, which is organized under the umbrella of CAANS and the Pan-Arab Society with the WFNS, of course, the two committee of the WFNS that I already said. So go ahead and thank you so much to join us.
Thank you very much, Najia. It's an honor and a privilege to join such an esteemed team from across the globe who are presenting the challenges, as you rightly say, about the work that women in neurosurgery have to undertake, which is significantly different and more than any of our gentlemen will ever realize. And I think it's congratulations to such a galaxy of stars from across the globe to have reached the levels of neurosurgery that you all have. It takes, I would imagine, I can only but imagine what efforts you all have made to reach where you are. And kudos to everyone, kudos to you, kudos to your families, really, because they are fundamentally the key in giving you that backing and support during times that it can become very challenging. So from the African perspective, we are equally proud that all across Northern Africa, South Africa, and more recently in Sub-Saharan Africa, we have had the pleasure of seeing young women join into this profession and become good at what they are doing and become renowned in what they are doing. So I wish to congratulate all of them who are on this panel and who have colleagues who could not join. Some of the challenges that we would need to address for women in neurosurgery, certainly in the African continent, is the challenge of how a woman, a lady neurosurgeon, during periods of family life, pregnancy, etc., or delivery and looking after babies in their alongside their career, can be given the opportunity that sometimes is available to some of our colleagues in the West. They have prolonged periods of maternity leave, which is covered somewhat through adequate pay, or maybe not adequate all the time, but certainly, but we don't seem to have that opportunity for our women in neurosurgery in Africa. If you want to take maternity leave more than a month, then you've got to do without pay, for instance. So I know that Gail is on the WHO committee, and we'd like to see the WFNS take a lead in this to ensure that women who want to participate in the leadership roles and the very difficult specialties such as neurosurgery, and that not just neurosurgery. I'm talking about cardiothoracic surgery, I'm talking about complex maxillofacial surgeries, complex ophthalmic surgeries. Women need to be able to do that without worrying as to what will I do when I decide to have a family and then have to take maternity leave. Will my incomes become reduced, etc. So there are lots of challenges that lie ahead, but it's very pleasing to see that in Africa we have some countries, and Algeria is certainly the leader in this, where we have many women in neurosurgery who've taken up this challenge and are doing very well, and no one better to give us that example but Souad, who I can see is on the panel. And Souad, we really congratulate you in Algeria, where you really have shown the light on how women in neurosurgery in Africa can be successful. So thank you very much. The chairperson of the Education Committee, Isabelle, is here, and really a pleasure to see you. And really all the folks who are on this webinar make us truly proud that we too can be on the world stage, both the gentlemen and the women. And Najia is making an example, and we wish her all the best, because she's going to hopefully be, Najia, the first women president of the WFNS, inshallah, as they say. So we really wish you all the best, Najia, in your endeavors. You truly make us proud. And I think we are getting there in Africa. And I can only say best of luck to all of you and to our president-elect nominee, Najia, as she tries to show how women in neurosurgery in Africa and across the world can strive to get to the peak of our profession. So with that, I leave it back to you, Najia. Thank you very much.
Thank you so much, my dear Moody, for this really kind word and your encouragement. I know how you are committed to African continent and neurosurgery, how many things that you are doing for our continent in neurosurgery, and thank you for your support for this candidacy. I hope, as you wish us, that we can succeed this time to have one African president of the WFNS, and of course with the help of all our friends here and the others that they don't hear, they help us to achieve this goal. It's the goal of all the continent, not only for Najia or Moody or etc., but it's the goal for our continent. You are doing, our pioneer did a lot, as a Professor Hamnishi is here and others, and I am very happy to be represent our continent, our area, and our country as a candidate. Thank you very much, Moody, for your very, very kind words. For all the women's also attending this symposium. Thank you so much. So I think we will start our our symposium with the first session, which was the session of the WFNS the WFNS Committee Training and Education Committee with the Professor Isabelle Germano. You know her very well. I think it's not she does't need to introduce her. She is one of the pioneer in the neuro-oncology, neurology, and the neurosurgery. She took this task from 2 years or 4 years now, and she did a lot and a great work around the world. She's always accepting when we ask her to doing some education webinar, or before the situation of COVID, she was always traveling around the world to achieving this goal, which is education and the training in neurosurgery. Thank you very much, my dear Isabelle, to accept our invitation, and I know you always say yes. Thank you for that, and go ahead with your session. you will moderate it alone, because our president, as I told you, he had a commitment, but he will join us in the end of the symposium. Thank you, Isabelle, and thank you all the speakers and your committee, the member of your committee, to join this this session.
Thank you very much.
Isabelle.
It's a pleasure to be here. It's a pleasure to have organized this with you and Professor Souad Bakhti. As you said, we've known each other for many, many years, but over the past 4 years, we worked all together, and I think we developed some incredible network, not only within the WFNS, but also outside. And so this is really the purpose of this first segment, is to show that although we're very proud of our organization, the WFNS, we continue to collaborate with people that are outside, because it's only by cross-fertilization that we continue to grow. And before I go into the session, I would like just to say one word in comment to Moody. A beautiful introduction, and thank you for the inspiring words, just so that people don't get confused that, you know, in the US, we might have something that the rest of the world doesn't have. For my first child, I had 7 days of quote unquote maternity leave. For the second child, I had 10 days. And both of those times came out of my paid vacation. So I had to take my vacation at that time. So there's still a lot of ground that needs to be covered. And the reason why I'm mentioning it is because I think we made some progress, but I didn't want to give the false impression that the neighbor's grass is greener. I think we want for everybody's grass to be green, and we will continue to build on this. With that said, I am very honored to introduce our first speaker, Professor Aruna Ganju. She is at Northwestern. She is the editor of the American Association of Neurological Surgeons publication that is called Neurosurgeon, and she has many more leadership roles. And today she is here to talk to us about mentorship versus sponsorship, progress of women in neurosurgery. Aruna, thank you very much for being with us.
Thank you, Dr. Germano. Let me share my slides. Can you see my slides?
Very well, thank you.
Okay, excellent. Well, thank you. As Professor Germano mentioned, I am in Chicago, USA, at Northwestern University. It's my pleasure and honor to be invited here to the WFNS Symposium on the progress of women in neurosurgery and international leaders, if you will. And this morning, I'm going to briefly cover the twin concepts of mentorship and sponsorship, and how this has influenced the role of women in organized neurosurgery in the United States. Once again, it's an honor to be here. And, you know, to the directors and co-directors, Professors El Abbadi, Bakhti, and Germano, thank you for putting together this program. Also, Dr. Hassani. I'm very excited to connect with colleagues worldwide and hear not only about the work that has been done, but the work that still remains to be done. And so with that, I'm going to start by highlighting an important moment in the history of our country. And this occurred last year when Kamala Harris was the first female elected to the vice president office in the United States. And in her speech, the evening that, you know, their victory was acknowledged, if you will, she recognized the role that her mother and other women had played in paving the road to her journey and achievement, if you will. And she acknowledged the shoulders upon which she stood. But she also ended with this. And she said, but while I may be the first woman in this office, I will not be the last, because every little girl watching tonight sees that this is a country of possibilities. And to the children of our country, regardless of your gender, our country has sent you a clear message. dream with ambition, lead with conviction, and see yourselves in a way that others may not, simply because they've never seen it before. And, you know, quite honestly, I think that is a message that each one of us has carried in our hearts, right, through this neurosurgical journey. And so for a minute, I'll pause and I'll ask you, how is your interest in the field peaked? What is the origin? Who were your mentors? Who were your sponsors? Because none of us has gotten to this point on our own, solely on our own, you know, achievements. It took a village, right, for us to get here. And so if we look at academic medicine in the United States, certainly over the past, let's say 10, 15, 20 years, the numbers have equaled or evened out. If you look at the beginning, percentage of women entering medical school in the United States and also matriculating, depending upon the year that you look at and the source, it is majority women, ranging anywhere from 51 to 60%. But if you look at the other end, at the top of the academic ladder, we don't see those same numbers, okay? So 22% of full professors are female. And this is across all specialties in the United States. 18% of department chairs are female. 17% of medical school dean positions are occupied by a woman. So why the leaky pipeline? If women are entering in equal or if not greater numbers at the beginning, what happens in the course of that journey? And certainly the Journal of Neurosurgery and specifically Neurosurgical Focus this March shone a light on the international leaders, women leaders within neurosurgery. And for those of you who have not read this issue, I would highly encourage taking a look. It's a worldwide view of our field and the females that have pushed it forward. If we look briefly at some firsts in our field, Diana Beck, Dr. Diana Beck, who is a British woman, is often credited with being the first female neurosurgeon. In the United States in 1961, Dr. Ruth Kerr Jacoby was the first board certified neurosurgeon. It took until 2005, though, for the first female chairman of a neurosurgery department, and that occurred at the University of Michigan when Dr. Corinne Marasca was appointed chair. And then most recently, 2018, Dr. Shelley Timmons became the president of the WFNS. So a long, long road, if you will. One important note in the history of women in neurosurgery is the establishment and creation of WINS. And as many of you know, this was founded in 1989 by a small group of female pioneer neurosurgeons, many of whom are with us this morning. And really, the group was founded to meet and support the professional and personal needs of female neurosurgeons, recognizing that there is and was potential for women within our field. And so the WFNS and WINS commissioned a white paper, which I think many of us are familiar with, in 2008. Once again, a number of our esteemed colleagues, many of whom are with us this morning, and specifically they were asked to address the issues in regard to recruitment and retention of women within our field. And they basically designated two goals. Number one, to increase the percentage of female residents to 20%, and number two, to increase the percentage of female faculty. And this goal of achieving 20% by 2020 was laid out in the paper. In 2016, Renfro et al. Looked at the progress of female residents within our field, and specifically they looked at the recruitment and then retention of women for over this 10-year span, if you will. And so during this period, what they found was that 12% of all residents within our field were female. And although progress had been made in terms of the attrition rate for females, which had decreased actually from 25 to 17% in this paper, nevertheless, there was a difference between the female and male attrition rate, 17% versus 5%. Okay. And then in 2018, when Dr. Timmons ascended the presidency of WFNS, Drs. Abash and Rutka looked at the numbers once again in neurosurgery and shone a light on this issue. Where are women in academic neurosurgery in the United States? As Dr. Beans noted, he said, you know what, the barriers may not be obvious, they may not be acknowledged, but they are most definitely there. And there is this issue or this term that we call trickle-down academics. So 51% of matriculating medical students are female. However, less than 20% of applicants to neurosurgical programs are female. Only 8% of practicing neurosurgeons in the United States are female, and then only 6% are board certified. So where do they go? And what's the issue? Well, bias, harassment, lack of mentoring, inequity in multiple levels. This graph depicts the progress of women and specifically residents in training programs in the United States, going from 4.7 to 12% in 2004. And 2008, we had the white paper call to action. So how do we achieve the goals that we want to achieve? Well, through mentorship and sponsorship. There are similarities and differences between the two. Mentorship, essentially, we have a relationship between a mentee and a mentor. The mentor can be at any level of the organization, and they essentially coach the younger colleague, if you will. And the goal is professional growth. Oftentimes, there may be building of self-esteem or skills. In contrast, sponsorship is a relationship between two people, a protege and a sponsor. The sponsor is somebody who is highly placed within an organization, and so they can utilize power and influence to advocate for the protege. It is not necessary that there is any sort of personal relationship, and the goal here is career advancement. Okay. At Johns Hopkins University in 2016, they undertook a qualitative survey, 12 chairs, 11 proteges. This was a series of interviews, if you will, that were conducted. These were not necessarily dyads of two people in a relationship. And essentially 5 common themes emerged. Number 1, sponsorship is episodic. Effective sponsors are career established. Effective proteges rise to the task. There has to be trust and respect between the two parties, and sponsorship is critical for career advancement. Okay, and so here in this Venn diagram, you see the differences and the similarities between the two. And mentorship, it's very early, or rather very important early in one's career for career development. It's a longitudinal sort of relationship. Sponsorship, on the other hand, is important later in one's career. It is critical for career advancement, and you can think of it as being episodic. So there are specific episodes of career advancing opportunities. Nevertheless, both relationships require this mutual trust, respect, and loyalty. So we took a look at this issue for the neurosurgical focus issue in March of this year, and specifically looked at the progress of women in organized neurosurgery within the United States. And to start with, I will throw this up here. We looked at 5 neurosurgical organizations: CNS, WFNS, SNS, American Board of Neurosurgery, and the CSNS. Of note, prior to 2000, only once in the history of these 5 organizations had the top leadership role been occupied by a woman. And that role was actually in the WFNS, occupied by Louise Eisenhart, who, as many of you know, was a neuropathologist, not a neurosurgeon. In the ensuing 20 years, from 2000 to 2021, only 5 times was there a female leader across the board. And you see their names highlighted here. Dr. Timmons once in the WFNS, Dr. Marasco, the SNS, Dr. Liao, ABNS, and twice in the CSNS, Drs. Benzel and Stroink. Okay. And so we see this depicted here. Once again, 11% of women occupied the president's role in over a 20-year period. Simply looking at the 1 year, 2020, we looked at the representation of women on executive committees and subcommittees. This ranged in the high teens, 19 to 16%. This is also depicted in this graph here. And actually, in the third column, we looked at the percentage of female speakers from 2000 to 2018. And this was a paltry 8%. 8%. So sponsorship matters. And perhaps with women being on these committees, we will see more women in speaker roles at national and international conferences. We then took a look at the percentage of female trainees in the programs in the US over a 3-year period, 2018 to 2020. This was relatively stable in the low 20s, ranging from 22 to 28%. When we stratified in regard to whether the training program was in the top 20 versus not top 20, based on US News and World Report rankings, really not much difference. About 24% of entering residents were female. This is depicted in this graph here. And once again, of note, during the same time period, percentage of board certified neurosurgeons who are female has remained relatively constant, just above 6%. So what was the conclusion? Well, society leadership matters. It plays a role not only in career advancement, but also academic advancement. Leaders of societies, they exert an influence upon societies, upon the specialty, upon the organization. So where are we now? And more importantly, where do we want to be? And the question is, where do we want to be as a specialty, as neurosurgeons, as mothers, wives, daughters, sisters? And actually, most importantly, I would say as humans, as a society, where do we want to be? Okay, and why should we be sponsors? Well, women tend to be over-mentored and they are under-sponsored. There is gain for sponsors, professional gain, personal gain, as well as for our proteges. As a sponsor, you are recognized for discovering talent. You benefit from the insight and perspective of your protege. And this hopefully will propel our field into the future. Okay. And why does it matter? Well, a diverse workforce is needed. The demographic is changing. And certainly there have been many studies that support, better patient outcomes when patients are met by, let's say, providers that are of a similar background, whether it is gender, ethnicity, or whatever. Okay. So we need to diversify our workforce. And certainly diversity and inclusion are inherent to successful evolution, whether we're talking the business world, the natural world, the tech world, or even neurosurgery. And many of us think of neurosurgery as being the top, right? The pinnacle of all medical and surgical specialties. Don't we want to attract the best and brightest to our field? Absolutely, yeah. And on a personal note, this is why it matters. These are my two daughters, 14 and 11. Both are aspiring surgeons. You know what? It is my hope and dream that their generation will not meet the obstacles that we have all dealt with and have overcome. Right? It has to be a better world. Absolutely. So what is the solution? Many things, right? Mentorship programs, diversity in hiring, prioritization of women up on the podium, equal and fair remuneration, and eliminating harassment and perhaps trying to minimize bias. What can each of us do? Well, we can be mentors, we can be sponsors. So at a mentorship level, you know what? Invite students to the clinic, to the OR, invite residents to join in on papers. If you are a senior colleague, invite your junior colleagues to committee meetings, put them on the podium, give them a chance, sponsor them, let them rise to the occasion. I don't think you'll be disappointed. And I want to acknowledge briefly my mentees. I would only be too honored to call these first three people proteges because they are accomplished, far more accomplished than I was or will be. But also I want to recognize mentors and sponsors, specifically Drs. Benzel and Marasco, as well as many others, too many to list here. And actually a shout out to my first neurosurgical mentor, Dr. Linda Sternow, whom some of you may know. And with that, I will conclude. And once again, thank you for allowing me to be here and speak to you this morning.
Thank you, Aruna. This was a spectacular talk. And I think that most of the audience will say, wow, how do we get there? And so our second speaker represents the very early phases of leadership in neurosurgery. Our second speaker is Halima Tabani, who was born in Pakistan, and she is currently a first-year resident. So we go from professor, editor of the WFNS neurosurgeon publication to somebody that just started, and she will share with us what are the leadership skills that she had or she did not have to reach that point? Halima, if you are on the line, you can grab the bar and share your slides.
Okay. Hello, everyone. Thank you so much for the kind introduction, Dr. Germano. My name is Halima Tabani, and as Dr. Germano mentioned, I'm a first-year neurosurgery resident at Mount Sinai Hospital in New York. And I feel very honored to be given the opportunity to speak at this forum among such prestigious faculty members. And today I'm going to be sharing my perspective and my story about my journey as an international female pursuing neurosurgery in the United States. So to give a little bit of a background, as Dr. Germano mentioned, I was born and raised in Pakistan. And as some of you might know, Pakistan is a small country in South Asia. And despite its small size, it is it's the 5th most populous country in the world. And even in this day and age, unfortunately, the society there is a very male-dominated society, and there is a prevalence of patriarchal culture there, due to which female education is scorned upon. So when I started my journey, no one in my family had ever studied beyond high school, and I had to break that norm and be the first person in my entire extended family to go to high school. I went to med school at the Al Khan University in Karachi, where I developed a passion for neurosurgery. And then once I graduated, I came to the United States and did a research fellowship at UCSF, followed by a clinical fellowship at Mount Sinai. And now I'm a neurosurgery resident at Sinai. And throughout this journey, I had some excellent mentors who inspired me to go on and pursue neurosurgery. But I'd like to point out that all throughout a period of almost 10 years from when I started my journey to now, the first time that I ever had a female mentor in neurosurgery was when I came to Sinai and I met Dr. Germano, and who's been kind enough to mentor me. So that's one of the themes that I want to touch upon during my presentation today. So with that background, I just want to start with a few facts that most of us already know, but just to touch upon about females in neurosurgery and also about international graduates in neurosurgery. So these graphs are from the American Medical Association, and these are the statistics from December of 2019. And they show the percentage of active physicians who are females by specialty in 2019 on the left, and the percentage of female residents and fellows based on their specialties on the right. As you can see that for both of these, neurosurgery falls at almost the very bottom. And if you look at specific numbers, about 9% of active physicians in the US workforce in neurosurgery are females, and about 19% of residents and fellows in neurosurgery are females. And this, interestingly, falls in the same category as some of the other competitive surgical specialties such as orthopedics, cardiothoracic surgery, and interventional cardiology. So on the same theme, this is a very interesting paper by one of my colleagues, Rifeng, under guidance of Dr. Germano, where they looked at women neurosurgeons in academic and other leadership positions in the United States. And this figure again touches upon the disparity in female representation in both faculty and residents in the workforce in the United States in neurosurgery. As depicted in the figure, the percentage of females in both faculty and resident positions is significantly lower than males. So to touch a little bit upon international medical graduates in neurosurgery, for the year 2020, according to the NRMP National Residency Matching Program database, about 88% of the applicants who matched into neurosurgery for that year were US medical graduates, and only about 7% were international medical graduates. And these figures are from another paper from our institution, again, under the guidance of Dr. Germano, which show the differences in in the cohort of the applicants who who pursued medical education in the United States as opposed to those who were international graduates. And as you can see that for international graduates, which is IA, the number of publications was higher, the number of programs that they applied to was higher, and the number of interviews that they were offered was lower. So all in all, neurosurgery, we know, is competitive, but it's all the more competitive for females, and even more so for international graduates. This is another paper that was published in 2014, which basically looked at the diversity and academic success of foreign trained academic neurosurgeons in the United States. And this map basically depicts the percentage of foreign trained neurosurgeon from all across the world. So you can see most of them came from Canada, followed by India. But the interesting thing that I wanted to point out in this graph is that in 2014, from Pakistan, there were 0 foreign trained academic neurosurgeons in the United States. So to turn gears a little, I wanted to touch upon the concept of leadership. As we all know, leadership can be defined in several different ways. And the first definition that's on there on my slide is the dictionary definition of leadership, which it's just the art of motivating a group of people to act towards achieving a goal. And then the second one is from Forbes magazine. It's the more modern definition, which defines leadership as a process of social influence, which maximizes the efforts of others towards the achievement of a goal. So looking at all these different definitions, especially in today's world of social media and influencers, I personally think of a leader as someone who's a trendsetter. So anyone who does something different or breaks a norm is a leader in their field. And if I look at my own example, when I did go to med school and then pursued an international education by coming to the United States, most of my siblings and then several other members from my family followed suit, and a lot of them ended up pursuing graduate degrees. So I want to touch a little bit about female leaders in neurosurgery. And as Dr. Ganju in her slides touched upon this already, I'll just keep it brief. But this is again from the paper from Ray, and the figure on the left basically shows that as compared to their male counterparts, women neurosurgeons had a significantly higher number of additional postgraduate degrees. And despite that, they had lower academic ranks compared with male neurosurgeons. So you can see that the bar towards the left is for assistant professors, that's the highest for females, as opposed to towards the right where we see the professors, and there's a disparity amongst the male and female leadership positions in that chart. And then the other two tables on the right basically show that in the 89-year history of organized neurosurgery, women leaders have only held 1% of officer positions in the top 7 US neurosurgical organizations. And this was, you also heard that in the previous presentation. And the office of president was held by a female only in 3 of the 7 top neurosurgical organizations. So we do have a far way to go. And as Dr. Ganju mentioned, there is a leaky pipeline where we are working towards enrolling a lot of females into residencies and fellowships, but then as they progress in their career, their success is not at the same level as compared to their male counterparts. And there are similar trends for international medical graduate leaders in neurosurgery, whereas as you can see that the values that have been highlighted in bold, that more IMGs had a PhD degree, and there were more IMG holding associate professorships as opposed to chair positions or full professorships. Which brings us to the topic of the glass ceiling. As we are all aware, there is a glass ceiling for females in general in surgery, but also in neurosurgery. And this is an interesting paper that was recently published in World Journal of Surgery, and this is from my alma mater. So this paper focuses on cultural barriers for women in surgery overall, and not particularly neurosurgery, but I think it has a lot of parallel themes for neurosurgery. The figure on the right, on the left, basically depicts the leaky pipeline, where, as you can see, the bottom, there's about 35% of residents. However, at the topmost of the pyramid, there's only 9.1% professors. And I found this paper interesting because they touched upon a lot of cultural themes that are prevalent in low middle income countries like Pakistan. And a lot of females shared their feelings about what cultural barriers they had to face. And you can see about 40% of the females in this survey documented that they were discouraged by their families and close friends from becoming a surgeon. And almost 90% of them felt that their culture perceived surgery as a male-dominated field. So having a surgical career would be a hindrance, not only for their, getting married, but also in their family life. As in most of our cultures, there are predefined gender roles. And in Pakistan, a greater percentage of females were taught that they were responsible mostly for household cooking, cleaning, and laundry, as opposed to males who were considered responsible for banking and finances and more important things. And this is just another table depicting the same concepts, where females did feel that they had cultural biases towards pursuing a surgical career. And in particularly, there were several concerns raised about how to maintain work-life balance as a surgeon. So just based on all these facts, I just want to come back and summarize what helped me during my journey when I chose to pursue this path towards neurosurgery. And first and foremost, mentorship, as we all know, is extremely important. It's one of the most fundamental stepping stones that inspired me to not only just pursue neurosurgery, but also to not give up when I did not succeed on my first couple of attempts. And going on the same theme, not only academic mentors, like Dr. Ganju mentioned in her presentation about standing on the shoulders of the females that inspire you. I personally had a great role model for resilience, in that my mother, who is just a high school graduate, but who was a single mother as my father passed away, and I was really young. And she, as a single mother, raised 5 children on her own, and helped each of us achieve our dreams. So I had a very strong role model for resilience. Of course, support system is also super important. And in my case, my family, my husband, always have been very supportive. And that has been the key part of my support system. And then networking opportunities such as WINS. So when I started, I wasn't aware of all these opportunities that existed, including WINS and a lot of other student platforms where there's networking opportunities for females, where you can essentially not only get inspired, but also get motivated when you see people similar to you or in your shoes, and people that you can look up to. Some of the things that I felt were missing during my journey were the lack of female mentors or role models. As I previously mentioned, that prior to coming to Sinai, in all of my journey, I had several mentors who helped me a lot, but I never had a female mentor before I met Dr. Germano. And it's important to have someone you can look up to in terms of not only what they do academically, but also how they balance their work life with their family life, and what inspires them to go on. So I feel that that's super important. That's something we still need to work on. I also felt that there was a lack of awareness on my part, and I also feel a lack of awareness on when you're a medical student about the available resources. So as a medical student, I never knew that WFNS had the WINS subcommittee where female neurosurgeons came together on a platform, and several other resources similar to that. Also, there was very little guidance regarding work-life balance, and then of course, coming from my background, there were multiple cultural barriers.
Halima, I think we have to wrap it up. I know that you could share many more things with us, but we have to get going with the program. I am very proud of you for sharing with us these very personal aspects of your life. And I know that many young people in the audience are very appreciative that you have done so. Because you are a role model, and we are here to applaud you, and also we look forward to your future career. And with that said, let's talk about somebody who is from Australia that had a incredible career. She's a woman leader that has been an educator for all her life, very generous with her time, Professor Kate Drummond. She is a member of the WFNS Education Committee. She has also held many important roles, including Chief Examiner in Neurosurgery for the Royal Australian College of Surgeon, and she's the Director of Neurosurgery at the Royal Melbourne Hospital and head of the CNS tumor at the VCCC Parkville. With that said, Kate, thank you so much for your incredible effort over the years. I know that you had many topics you want to share with us, but I did ask you to kind of look backward a little bit and share with us who paved the way so that we understand who we are, because those people paved it for us. So triple thanks for everything you do.
Thank you, Dr. Germano. Can you all hear me?
Yes, and we can see the slides. Thank you.
Excellent. So thank you so much, Dr. Germano, Dr. El Abbadi, and Dr. Bakhti for inviting me to speak. I think I'm very lucky because I'm probably getting to be the first person to talk a little bit about something that amazing that happened last year, and I'm only talking about one part of it, the Asian and Australasian part of it. But this is the history of women neurosurgeons in Asia and Australasia, and I'm extremely proud to talk about it. I also know that there's so many people who also worked on this project who are on the webinar tonight, and I'm terribly sorry if I don't mention all of you by name or all of the incredible journeys of your own that you've told us through the course of this. So as you'll hear over the course of this webinar from a number of different people, in 2020, there was really a global electronic working party of women neurosurgeons. It was really, I think, Gail Rousseau who pulled most of it together. But basically, women all over the world who couldn't meet in person met by Zoom, often every 2 weeks. And out of that came a number of histories of women neurosurgical leaders for their continent. So obviously Asia and Australasia for me, but there were 3 publications that came out of Europe and also out of Middle East, South America, Africa, and I think Gail is going to speak about these more later, so I'm not going to go into them any further other than to talk about the Asian and Australasian publication. So here it was published in the Journal of Clinical Neuroscience just recently, and you'll see a number of people who are on the webinar tonight who are also on this paper. But I saw Aneela there, Gail obviously, and Lynn Lucina as well. Sorry if I've missed anyone else who's logged in since then. So this was really looking at Asia and Australasia, which really is well, I guess a continent, really diversity in all its diversity, incredibly diverse with regards to geography. So from the heights of the Himalayas to the tiny Pacific island nations, for politics, for culture, from Western to Eastern to deeply conservative to relatively progressive, from healthcare dealing with both obesity and malnutrition in the same continent. Also, an aging population versus a high infant mortality rate. So really an incredibly diverse region to really cover. And as you can see, also great diversity in the percentage of women neurosurgeons. The Asian Australasian Society of Neurological Surgeons, which is the continental society, has 25,000 neurosurgeons in 25 different societies, with 60% of the world's neurosurgeons servicing 60% of the world's population, but with incredible inequity as to how those neurosurgeons are distributed amongst the population. And as you can see, a great diversity in women neurosurgeons, and of course many small nations having even no neurosurgeons at all. So the methodology was a chain referral sampling. So people who knew each other spoke to people who they knew until working groups and larger contributing networks were pulled together. We talked to local societies, embassies, WFNS database. Gail Rousseau made 427,000 phone calls. There was much oral history that we received, and each informant was asked for their country how many neurosurgeons and how many were women, and the data was often conflicting or difficult to reconcile. For instance, a country may have two different professional societies, which would give us two different sets of numbers because of different memberships. But we got the best data that we could. The history of the first women neurosurgeon in their country, and the stories of women neurosurgeons who've made contributions as leaders really in any capacity. And we had voluminous amounts of data, and I'm really wondering where I'm going to be able to put all of these wonderful stories at some stage that were really not able to be published in a 3,500 word article. So, these are the countries that have no neurosurgeons at all, often the smaller island nations of the Pacific, and also a number of smaller nations that have a small neurosurgical community that does not include any women. The countries that have no neurosurgeons are often serviced by general surgeons from the surrounds, often Australia and New Zealand, and this is sadly now departed Catherine Edevane, a general neurosurgeon who used to do much of the neurosurgery, a general surgeon who used to do much of the neurosurgery in Timor-Leste, often on the phone to me or other neurosurgeons, and with a lot of equipment donated. As you can see, the majority of other nations did have women neurosurgeons, but usually with small percentages. Actually, Mongolia has the largest percentage-wise of women neurosurgeons in the region, and have a long history of women participating in organised neurosurgery. So who were the trailblazers? Well, the first neurosurgeon was a female neurosurgeon in the region was Dr. T.S. Kanaka Professor T.S. Kanaka. She graduated, and she's in the centre there. She small in stature, but great in contribution. She graduated in 1968, which was only 7 years behind the first neurosurgeon in the United States. So she really was a trailblazer. The information that we got was that she was a lovable terror. And she, as is the theme for many of these women, had a simple life devoted to her patients and students, and she died still working at age 86. She brought functional and stereotactic, or pioneered functional and stereotactic neurosurgery in India. Of course, this picture here of the China Forum of Women in Neurosurgeons has a number of other trailblazers here with Yoko Kato, Ling Sen and Gail Rousseau in the picture, as well as Professor Kanaka. And she really was an extraordinary force and this is courtesy of Shweta Kedia, whose picture is here, of the 71 other Indian women neurosurgeons who have followed Professor Kanaga and her wonderful example over all of the years of her service. So then the subsequent trailblazers, Dr. Camelia Ponsonchoy, shown here with Lynn Lucena, who is on the line in the Philippines, Dr. Javsma in Mongolia, Professor Elizabeth Lewis in Australia, who gave us some wonderful stories of being only able to get work at times in a hospital which was called the Schilling Hospital, which had only one male employee who was the porter. It was called the Schilling Hospital because Victorians had been asked to donate a shilling to have a hospital for women run by women, and only one man is the porter. Dr. Hayu Suk Chung in South Korea, Professor Pu Piu in China, and of course Professor Yoko Kato in Japan in 1985, who's been a force of nature for neurosurgery and women in neurosurgery. After those trailblazers in the 1990s, we again had a number of countries have their first neurosurgeon: Taiwan, Vietnam, Thailand, and I'll highlight here Dr. Jean Winkatu of Indonesia. She was one of the highest-ranking naval officers in Indonesia and had an extremely distinguished career, and died just recently of COVID-19. In Singapore, and then in 1997 in New Zealand, Dr. Suzanne Jackson. In the new millennium, I can't possibly go through all of the people, the countries who had their first neurosurgeon in woman neurosurgeon in the new millennium, but it brought really two things. The first is groups of women neurosurgeons that the photos were sent to us of women neurosurgeons meeting, forming groups where they could network and support each other. And I put this photo in here, and it's become quite topical, really. This is Virginia Meixner, who was the first Australian, not just neurosurgical, but any surgical trainee who was granted maternity leave in Australia. So a great trailblazer there. You'll have to read the article, because I couldn't possibly, in the time that I have, go through all of the contributions of these women. In organised neurosurgery, they've been leaders of national and international societies. In academic neurosurgery, there have been multiple heads of department, heads of training. And in the wider world, really, all of the women who we spoke to really had a life of service in the military, like Dr. Wakatu, multiple examples of philanthropy, often developing hospitals, particularly for the poor, and teaching and training in emerging nations. There are poets and artists. Lynn Lucena, of course, is a wonderful poet, and I'll show you an example of some of the art. And I put this picture here for two reasons. Firstly, it was taken by my mentor, Professor Kay, to celebrate a time when he found himself in an all-woman operating theatre, from anaesthetists to nurses to ENT surgeon for the skull base and to assistant. And his assistant here is Dr. Ruth Mitchell, Australian neurosurgeon who accepted the Nobel Peace Prize recently as a founding member of the international campaign to abolish nuclear weapons, one of the highest pinnacles, I think, of a life of service, and I'm proud to call her a colleague. Throughout, obviously, putting the bland history together, we were told of joys and challenges, and I'll just talk about the challenges first, and many of them have been mentioned, and then I'll just briefly outline the joys. Of course, rigid gender roles and social expectations were often very prominent in deeply conservative or religious societies. The stigma of working alone with men, often late at night, and the intricacies of pregnancy and child rearing, often having to hide pregnancy until the very last moment under voluminous garments, which I thought was fantastic, but perhaps having a little less problem sometimes with child care because of the nature of the extended family in many countries in Asia. There's, as been mentioned, a low priority for education of women, exploitation and discrimination for places in training and for professional progression, and many stories of inability to find meaningful work, often meaning, well, I'll set up my own hospital because there's no other way that I can work. Not being given any operating, no pay, no office, no seat to sit on, and also patient apprehension for being treated by a woman, and a deep sense of outsider or other. The joys, though, were many. Role modelling, mentorship and sponsorship of mostly male senior colleagues, and this beautiful comment from one woman neurosurgeon that one of the men that she worked with was a banyan tree under which many resident neurosurgeons got shelter. And few regrets, with one Indian neurosurgeon saying that they'd be very happy to be reborn as a neurosurgeon with all its highs and lows. And the support of partners, parents and families, which was critical and really very appreciated. And I'll finish with this. We discovered so many hidden talents among the neurosurgeons who we ended up connecting with in this global Zoom hookup. And one of them was Dr. Warrelux, who is a very talented artist, and two pieces of her work ended up in our article. This is The Surgeon's Mind. And I love this woman neurosurgeon looking out into the future. And Warrelux tells us that if you look into the eyes of the surgeon, you'll see someone who's devoted their life to their art. I'll leave that there, and thank you so much for the opportunity to present this work. I know that other people will be presenting from other continents later, and I'm sure you'll find it fascinating as we found it to put together. Thanks very much.
Thank you so much. This is a fantastic talk and also an incredible amount of work. And thank you for going from oral history all the way to written. Congratulations. And thank you, Gail. I know you're going to talk about other topics later, but really fantastic work. So we're trying to touch, as I said, on a few different topics in this first segment. And the next topic that I think is one that is dear to each of us is how do you become a leader in what you do? And here we have the example of somebody that is a fantastic pituitary neurosurgeon. Not only that, but she is chair of the Department of Neurosurgery at Istanbul. Nurperi, thank you very much, Professor Gazioglu, for joining us today. We are here to learn from you. What is the secret sauce? What are the ingredients, right, that each of us should have to accomplish what you did? Thank you.
Sorry. I'm sorry for the delay. Cannot find my presentation. Yeah. Okay. Dear members of the WFNS organizing committee and dear chairperson, thank you for the kind introduction. My talk will focus on my leadership career as a pituitary neurosurgeon. I was born in Istanbul. I was born in Istanbul in 1958 as a unique girl of my parents, and I am lucky to live and work in Istanbul, a 15 million cosmopolitan metropole. I was graduated from Galatasaray High School in 1976, which is Turkish and French mixed education high school. I was interested during my years of college to psychology, to foreign languages and cultures. So I learned Italian and Spanish also. Then I studied medicine in Istanbul University, Cerrahpaşa Medical School, with the ideal of becoming a psychiatrist. But during my years of medical student, I loved neuroscience and neurosurgery, and I earned my MD degree in 1984. As usual in our country, we do 2 years of obligatory service in other cities. And so I went to Siirt, Sason, you see here. Here is Istanbul. I went to the other side of Turkey, to the another Anatolian city, Siirt, Sason, and I worked there as a generalist MD for 2 years. You see a picture from those days. Then I returned back to Istanbul University, Cerrahpaşa Medical School, and I started my career in neurosurgery training. I was lucky to be in the Cerrahpaşa because we had the tradition of, we were used to have female residents. Before me, there was Dilek Leblebicioğlu and Hamiyet Camuşçu. You see here a picture from those days, Hamiyet and Dilek. And this is our chair, Professor Cengiz Kuday, and our founder of our department, Professor Feyyaz Berkay, who was a fellow at the University of St. Louis with Professor Klemme, and he was also a board certified, American board certified neurosurgeon. And this is my mentor and my master, Professor Ertuğrul Sayın. I should say some words about Turkish women neurosurgeons. Aysima Altınok, you see here and here, is the first woman neurosurgeon of Turkey. She was certified at 1959, and she was followed by Yıldız Yalçınlar in Ankara in 1 year later. But 20 years, about 20 years, they were the only female neurosurgeons of our country. After then came Dilek, Hamiyet, and me in Istanbul University. I was the first woman faculty member in Turkey in 2000, and I was nominated full professor at 2008, and I was the first full professor also in Turkey. Currently, I'm happy that I was followed by many others, and there are 93 board certified women neurosurgeons in our country, and 13 of them are full professors and 10 associate professors. So we are happy to be together. Here you see a picture of one of my colleagues. And I think the proportion of female neurosurgeons and in academic positions is quite well. If I turn back to my training, I had my observership in France, in Hôpital Lariboisière with Professor Bernard Georges, and Hôpital Necker-Enfants Malades with Professor Jean-François Hirsch and other professors, Alain Pierre Kahn, Sainte-Rose, and Renier. I was invited to become a member of ISPN by Professor Hirsch and Professor Khan. And I returned back to Necker for neuroendoscopy. For my pituitary career, surgery career, my master and mentor was Professor Ertuğrul Sayın, rest in peace. He was a fellow in Queen Square, London, and he initiated transsphenoidal microsurgery in Cerrahpaşa in 1980. But he was not the only one who initiated this surgery. He was helped with the faculty members, other faculty members, an ENT Professor Nihat Şekercioğlu and an endocrinologist, Professor Sadi Gündoğdu. They were followed by Professor Hüsrev Hatemi, and now my colleague and friend, Professor Pınar Kadıoğlu, is the main endocrinologist of the pituitary program, and she was also the fellow of Professor Shlomo Mehmet. My pituitary surgery experience started during my residency. It was a transsphenoidal microsurgery mainly. Then I, as a neurosurgeon, had special interest for pituitary surgery, but it was mainly microsurgery until 2005. I went to international congresses and I made research and I learned a lot from my idols at that time, Professor Ed Loos Jr. and Professor Rudolf Falbusch. I became member of the Pituitary Society and of the International Society for Pituitary Surgeons. After 2000, endoscopic pituitary surgery became popularized in all over the world, and we started our journey on 2005 at Cerrahpaşa. I organized a lot of courses on cadaver dissections, conferences, and live surgeries. I was also helped by my colleagues and friends, Italian world masters, Professor Giorgio Frank, Enrico De Divitis, and Davide Locatelli. Here you see some pictures of our courses. This is our team. You see that we have many female residents, and I switched from microsurgery to endoscopic pituitary surgery. This is quite rare in neurosurgical experience because switching from microsurgery to endoscopic surgery is not so easy. You should learn a different tool and technique, and you should leave your comfort zone. But Dr. Ed Loos mentions and stresses the importance of versatility. So this is universally true in the era of personalized medicine. The main advantages of endoscopy, I should mention, are two important advantages. The limits and indications of transsphenoidal, transbasal surgery are enlarged, and we have a better view of the tumor cavity and its corners. In 2007, Professor Necmettin Tanrıöver, my colleague, joined pituitary surgery team. He was the fellow of Professor Roton in his cadaver laboratory for 4 years. Multidisciplinary team tradition, which we had since many years, and the increasing importance of pituitary centers of excellence enabled us to found in 2015 our pituitary center in Istanbul University. This is the second pituitary center in Turkey after Kocaeli University. With the faculty from Kocaeli University, Professor Savaş Ceylan and his colleagues, and my colleague, Professor Necmettin Tanrıöver, and I, we co-worked for promoting endoscopic pituitary surgery and neuroendoscopy in different university hospitals of Anatolia in Turkey. Here you see some of these live surgery courses that we organized in different cities of Turkey, mainly in the eastern part of Turkey. And this is recently we organized our 6th Istanbul Pituitary Symposium, online of course because of pandemic. We have a lot of experience in pituitary surgery and endoscopic skull-based surgery, and here some of the our patients' numbers, just to show you our experience. I presented my experience on Cushing's disease on Academia Eurasiana Neurosurgica, and I was nominated as a member of the Academy by Professor Necmettin Pamir in 2009. Pituitary is an exciting subject of research and practice. Pituitary tumors are mainly considered benign lesions, whole grade 1 lesions, but they have so much negative impact on the quality of life of patients that these tumors might be considered as pituitary neuroendocrine tumors, PITNETs. We have so many questions regarding tumorigenesis, genetic factors influencing recurrence, invasion, tumor consistency, familial occurrence, and medical treatment options. Finally, to conclude, I have some personal recommendations, take-home messages. To succeed as a pituitary surgeon, these are of course for young trainees and colleagues. To succeed as a pituitary surgeon, you have to study endocrinology, anatomy, neuroradiology, and genetics. Work harmoniously with team members and be kind to the patient and their family. Here you see our mentor, one of our biggest names of neurosurgery in the world, Professor Harvey Cushing, that says a physician is obliged to consider more than a diseased organ, more than the whole man, he must view the man in his world. And the final recommendations: train on cadavers if possible, learn from experienced surgeons, be versatile and up to date, think about innovation, be confident to yourself, and never ever give up. Thank you. You are mute, Professor Germano.
Thank you so much. Very inspiring talk and very inspiring words on your last slide that we will go and ask you more questions at the end, because I think that is really the punchline of this segment. And without hesitation, we'll continue on with Professor Nelci Zanon, who is the chair of the WFNS Pediatric Committee. And she has also many other leadership roles, including the chair of WIN in Brazil, the co-chair of the Educational Committee for the International Society of Pediatric Neurosurgeons. And she also has she is also founder of the WhatsApp for Women in Neurosurgery around the world. Nancy, thank you so much. You were able to put us all together on the same page, meaning on the phone. We really appreciate all the effort to the field of pediatric neurosurgery and to connecting us globally. And today, Nelci, Professor Zanon, will share with us the Women in Neurosurgery leaders at the WFNS over the past years. Thank you.
Thank you very much, Isabelle, for these kind words. Thanks a lot, Najia El Abbadi and Souad Bakhti, for this wonderful symposium. And it's a privilege for me to be on stage and talk about the leaders that open doors for us today. If we are here, we need to acknowledge those that open doors. I'm working in São Paulo and hope soon we can meet each other together. I will talk about World Federation of Leaders and the impact, not only in Brazil, but also in South America WIN groups. The World Federation was founded in 1955, and at that time it was 30,000 neurosurgeons worldwide. And now we have 50,000, and we need additional 23,000 neurosurgeons to fulfill the necessity of the world today. And we know and we see for the beautiful lectures before that the medical women in the medical school are increasing numbers, and we need to try to bring them for the neurosurgical field is a challenge for all of us. And how many years after the foundation of the World Neurosurgery start the WIN participation leaders? It was in 2009 with Professor Yoko Kato and Professor Gay Rousseau in the same year. Professor Rousseau shows the young neurosurgeons group work. And Yoko Kato was elected the first chair of the WIN committee at the World Federation. At that time, it was Jacques Prodigy, president of the World Federation, that rests in peace. And Professor Yoko Kato was already professor at the Fujita University and founded a woman neurosurgical group in Japan and also Women Neurosurgical Association. 12 years later, Yoko Kato still working at the World Federation now with executive board on World Federation Neurosurgical Society Foundation, and also Professor Rousseau still working as a chair of the World Federation and WHO Liaison Committee, and still active and bringing us thoughts about leadership. After Professor Kato, the WIN chair committee was took place with El Abbadi, and with Najia, I got the privilege to be the co-chair for these wonderful 4 years. And Najia have a lot of credential. She is head of Department of Neurosurgery of International University, also is head of Neurosurgical Department in his hospital. And also internationally, she is president of the Mediterranean Association of Neurological Surgeons and also president of the Pan-Arab Neurosurgical Society, and give value to World Federation like assistant treasurer since 2017. Now the WIN committee at the World Federation is on the hands of our wonderful colleague, Souad Bakhti. She is also professor on medical school, University in Algeria, head of the neurosurgical department, and a lot of interest on neuro-oncology and CNS malformation. And besides, she training also African students in neurosurgery and African neurosurgeons in her department. Probably the last meeting we was together organized by this wonderful group was in Morocco in 2019 with the WIN committee. Just to have an idea how World Federation is organized, our president, Professor Frank Servadei, and all the committees are the coordinator in the hands of Professor David Adelson. And there is standing committees, 7 of them, and there is also 26 ad hoc committees, and 2 of them, since I know for the first time, leading for you women, Education and Training Committee by Isabelle Germano, and myself on Pediatric Neurosurgical Committee, beside the Women in Neurosurgical Committee. And Education Committee did a lot of work on these crazy times with online meetings, and we are here together with WIN and education training. And one of things we need to show, Isabelle edits this wonderful ebook for free in several different languages, just to encourage the young women and childs to dream and maybe become a neurosurgeons in the future. On the pediatric committee, I have the co-chair Federico Di Rocco. And we are building for this committee a website, working together with senior resident and medical students. We learn during these pandemic times that we can do more if we are online, and together everyone can achieve more together than individually. And usually during the annual meeting, we have all the committees meeting. The first I participated was in Istanbul. And in China, Beijing meeting, just a little changement. Since then, the committee is still working for 4 years. And now this meeting was well organized for Linfeng. And the committees worked just for 2 years. I got the privilege to meet these wonderful leaders around the world these years. And it's always a learning curve for all of us to be in touch with them. And this is just to encourage the young women. In 2015 in Rome, the award for the young neurosurgeons was won for a young Brazilian, Gisele Coelho. And just to encourage the new leaders that maybe tomorrow you are here, and we hope we still too. When we start like a young juniors, we don't have an idea that few years later, this will be the figure. We are working together. And we start with a small paper on child's nervous system about the challenge to be a neurosurgeon in São Paulo. And after this start with the with the great international leaders. The WIN group in Brazil is a reality now with more than 200 women in neurosurgery. And we have the privilege to invite the invited speaker. The first was Gay Rousseau. The second one was Souad Bakhti. And in Latin America, it was this influence too, was created 2 years ago, the WIN group in Latin America, and still ongoing. And last year also the privilege to work with this international leader was quite an achievement for myself. And just to remind us, it is not only in neurosurgery that the women need to pay some gaps. In science, the women still make only around 30% of the professional research. And don't give up, stay on board. And thanks a lot, Gail, to encourage us to work on this paper with the leaders in Latin America. We will and publish this work with your support. Thank you very much. And the summary, acknowledge for all the WIN leaders at the World Federation the last years, apologize for those that we didn't mention, look at someone to inspire you, keep working and doing your best to find mentor or sponsor, stimulate mentoring, and maybe be one of them for the juniors. My mentors in neurosurgery was at the university, residence training, and in Marseille on pediatrics. pediatric neurosurgery. And maybe we can meet each other together physically in March next year with the World Federation neurosurgical meetings. And thank you very much for my team that's still working when I'm doing this online team. Thank you very much. And maybe I agree with Buddha. What you think you create, what you feel you attract, what you believe become reality. Still dreaming and working hard. We will be there. Thank you very much.
Thank you so much. This was a tour de force. You were really touching upon multiple of the aspects of WFNS and more. And the one thing that is fantastic is that we are on time, right? So I would like to really compliment the women of this group because we've been to many international symposia where unfortunately the time just was not even a consideration. So I think women are good at many things, including getting to the point. And so that will allow us to have 6 or 7 minutes of discussion. There are some questions that came on the WhatsApp. So maybe one that we can address together, and I'm gonna ask Nelci just because she's the last one who spoke, is in your years of leadership, if there is one single thing that you want to share with our younger audience, what would that be?
Thank you, Isabelle. Maybe it doesn't list anyone that give you the advice that you can do everything you want. If you decide to do it, do very well, work hard, keep studying, you will win. Doesn't matter what the people are telling you, because at the beginning, it was normally for me to listen that you at the end will be only a scrub nurse. Don't worry, you will never win. It's a crazy world. No one will keep you open ahead. And I doesn't listen. And I'm glad for that. And I advise you, because even today in 2021, I talk with medical students, they still listen this kind of advice. It is incredible. With this time, we can't listen this kind of not useful advice. Just keep doing, keep working. You will be there. You will be there, sure.
Persist, right? Aruna, what is the one thing that you will share with us that was the most important that you want to kind of pass along the next generation?
Wow. You know what? Dare to dream and dream big. I would echo what Dr. Zanon said. You have to be your own biggest supporter and also your harshest critic, right? You should see your strengths and your weaknesses. So nobody else should be telling you that, but absolutely dream big.
Excellent. Kate?
I would say find your team. So what everyone else has said is absolutely correct. You know, believe in yourself. Don't let anyone say no. But find your team. Who are your supports in every way? Who's your personal support? Who's your professional sponsors? Who are your professional mentors? Who are the people working under you who are going to support you and lift you up? So I think find and build your team, which will change throughout the course of your career, but the people around you are the most important.
Thank you. Nurperi, you in your last slide, you had many important words. If you have to pick one, which one would you pick to share? You're muted, so you have to unmute yourself. You're still muted.
I would like to say to young ladies to be confident to themselves and to do not having any barrier inside their idea. Don't let you disencourage, and work hard and critique yourself. It's an important point, I think. Be idealist and always think to do better than yourself.
Wonderful.
That's all.
So the other question that came is about publishing, right? Because it's very important to do what we do to take care of our patients, but ultimately it is also important to let people know what we're doing. And so, Aruna, this question is for you. You are the editor of the WFNS Neurosurgeon, which is the publication for the WFNS. What do you think the younger audience in this conference, couple of advices that you could share with them in publishing, not necessarily just in peer-reviewed paper, but also in other publications. And then I see Professor El Abbadi's hand, so we'll go right after to her. But just if you don't mind, share with us, how do we go by publishing, not necessarily in peer-reviewed publications, but also in other publications that might actually influence the community of neurosurgeons?
Yeah, I think that's a great question. And actually at WFNS Neurosurgeon, we're kind of making advances in that regard. So what I mean specifically, if any of you are not familiar with the online journal, I would encourage you, check it out online. There's essentially a portal. Everybody is invited to submit pieces. This is essentially the socioeconomic journal of our specialty. It's not peer-reviewed. Submissions are invited, but also you can absolutely submit a manuscript of your own choice. We will review it. If it is in line with the theme, we will include it. I will tell you, on our editorial board, we have added medical student members and most recently resident members. And this is specifically for the purposes of bringing in the younger generation. It's not that my 2 med student members and my 2 resident members are going to write all the articles. No, I want them to network across the country, across the world, and bring in their generation. So for the younger trainees, whether you're a medical student or resident, absolutely identify mentors at your institution. Ask what projects you can write up, what pieces can you write. You can absolutely reach out to me. Our email is there on the website. I'm kind of kicking myself now for not having organized an issue in line with this theme, but you know what? It is of no consequence. I think we'll get on it. And so I invite all of you from all the generations. We would love to publish your stuff online. So we'll do it.
Thank you, Aruna. And so Professor El Abbadi, your hand is up. You're still muted. Unmute yourself. And we would like to hear your words to close this first segment. Thank you.
Thank you, Isabelle. And I would like to congratulate all the speakers. It's really very amazing and inspiring for us. All of them give us many advices and for especially for young neurosurgeon, how to become a neurosurgeon and how to embrace the academic way. And I'm really very happy to see our friend, for example, from Turkey, Professor Nurperi, that she is very humble with the huge experience and endoscopic approaches. And in the literature and also in some webinars, we saw some mail spoke about these approaches and had a lot less than your experience. So I would like to emphasize that women are more humble, that we need maybe to be more aggressive, not aggressive, it means more aggressive in the webinars and the participations and the educations more and more, and the workshops, and also maybe we need to publish more paper in the literature. And thank you also for our friends Kate, Drummond. You are really really amazing, because what you shown us, it's very, very interesting. And I know that what you do for women as editor and chef of your journal, and Aruna just give us some advices how can us participate and publish more papers as women in that such journals, because it's very important journals with the highest highest impact factor. And finally, all the lectures are very, very interesting and very outstanding. Thank you so much for accepting to have with us. And of course, many thanks to our leaders, Isabelle, for this great moderation. She already told that she is on the time, and it's really very rare to be on a time, especially when there are more male, because they want to speak a lot. The testosterone sometimes it's more important than ever. So thank you so much, and thank you for all the men who support our cause. And we see here, we look at many of them are here present to support the women and in neurosurgery. Thank you to all of the men present today with us. Thank you, Isabelle. So you can take the word.
And thank you, Souad, for being co-chair of this symposium. You're inspiring to everybody. I'm gonna ask you to say a word so that we can move on with the second segment.
You're welcome, Isabelle, you're welcome. It was a pleasure.
So I think it's the end of the session, and maybe we will move. Thank you again for all that you are doing for this symposium, and welcome again. And we will move to the next session. And the next session, I will ask our next moderator. It's the Professor Hussam Husseini. Is he here? Pat? No, not yet. Maybe, but we have with us Professor Kazadi Kalango. He's here, of course. I saw him.
Hi, yes, I'm here.
Please, Kazadi. I think you can the second session, and alone we will contact Professor Hussam Husseini to join us to moderate this second session with you.
Okay.
And
excellent.
Okay.
Thank you very much. Thank you very much. I'm very honored to be invited to this excellent webinar and surrounded by very intelligent and beautiful ladies, and very committed. As you know, it is also my commitment really to promote ladies in neurosurgery, and we are doing all efforts, even in African continent, to try also to have women in neurosurgery, and it will happen. It's just a matter of time. Thank you very much for all speakers. It was beautiful and wonderful, really session. I enjoyed it. Now I'd like to call Professor Atul Goel, I hope I'm pronouncing properly, who is going to talk about brain healing, more divine than human. Professor Atul Goel is the head of the Department of Neurosurgery at the KEM Hospital and Seth GS Medical College panel in Mumbai. She is also a president of Neurosurgical Society of India. She's been actually in 2018, 2019, and currently president of Craniovertebral Junction and Spine Society. Please, Professor Atul Goel, please go ahead, and we are eager to hear what you are going to say. Thank you.
Thank you, Nazia, for inviting me. As you can imagine, to be invited by ladies and gorgeous ladies is indeed a wonderful honor. And because this honor is given to me, I will like to talk from my heart. So it is heart-to-heart talk. Essentially, I'm going to talk something philosophical. And you can imagine a technical neurosurgeon talking philosophy is not easy. This is difficult, but I will make an attempt. So I'm going to talk on the subject, brain healing is more divine than human. So this is an unusual subject. Water is life. You can imagine in a desert, if you get a glass of water like this gentleman, you can imagine what this glass of water means to him and what this bag of water on the head means to these people. And in this desert, you can imagine this person looking for water. And I was looking for a nice slide to present in front of ladies of the world. And I got this most wonderful slide. You can see in this desert, this lady is having a bottle of water, and she's giving that glass of water to these plants. And imagine this beautifully dressed girl with hair nicely combed. This is what is a lady neurosurgeon, the art of giving the most precious ornament of life. So I'm inspired by this slide, and I will like to discuss about neuraxial healing and how nature works on it, how God plays a role, and how minuscule a neurosurgeon is in front of what nature does and what God does in the healing process. So this is one Indian god. You might have seen this god, head of an elephant. He is the son of a creator of nature in Hindu mythology, creator of nature. He made stars, he made moon, he made universe. So he was the son of that creator. And he, by mistake, cut the head of his son, and then he introduced the head of an elephant. So there are too many things pertaining to this story. I don't want to go too much in, but imagine how the creator of nature can himself go wrong and create an absolute disaster by cutting the head. And then he mends his ways. And there are various people in the world who are beyond humans. They have achieved what they have achieved because they have something more than others. This is a work from ancient Hindu mythology. Vedas are amongst the most ancient literary works of the world. Human thought reached its zenith when the Vedas, means this Hindu mythology, and Upanishads were spoken. Thereafter, mankind has never scaled such heights. So this is just a few words from our mythology. Nature, the universe, is made of three elements. One is mud, one is water, and one is air. So there are three things which make the universe: mud or earth, water, air, and this fire extinguishes or destroys the life. So these are the four important participants which make nature, which make the entire universe, which make the entire world that we see and we observe and we imagine. If knowledge is infinite, so is ignorance. I want to introduce to you some philosophical issues about embryo. This word comes from the word, the meaning is it swells, and then it grows, and then it develops, and then it matures, and then it comes to life. A sperm and ovum, they meet each other and make a zygote. And a new cell is born. This is one new cell, and it is called a neocyte. A new cell is born, and then there is a process called neocytogenesis. You can imagine from one cell, which is very similar in all living organisms. It is similar in human being. That's this zygote is similar in elephant, in horses, in Einstein, in everybody. This is very similar. And from this single featureless cell called zygote, brain is developed. You see how it matures, it multiplies, 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 and brain is developed. And there are 13 billion cells which are neural, and out of the 13 billion, 130 billion cells are glial cells. And there are 100 trillion cells which make a human being. Imagine from one cell to 100 trillion cells, and also imagine that there is no possibility of any error in multiplication. Multiplication, multiplication, and there can be no mistake. There can be no terror of error in nature. And you can imagine this zygote, which is very similar in all living organisms, has to give rise to a human being or has to give rise to a monkey. You cannot imagine if one zygote makes a mistake during the maturing, and by mistake a human form, instead of a human being, a monkey is born to a human being. You have never heard that, because mistakes are not possible. It is a process which can never be understood, how from one cell's 100 trillion cells are born, and how a human being is made functional and made to think. At 8 weeks of fetal life, which is when the fetus is 1 inch long, the entire human being is born. Means all the named arteries and all the named nerves are there in 1 inch of embryo. And from there develops growth, and then develops the process of growing of this 1 inch into further processing. So all mammalian embryos, now please carefully see these slides, all mammalian embryos are completely formed when 1 inch long. And after that, it is only development, growth of that 1 inch. Organogenesis, all organs are complete at 8 weeks when 1 inch. After 8 weeks, the ensuing fetal stage is more of growth and not so much of development. So it grows. Then the fetal is only growth. It develops. It increases in size. So all the growth of a fetus or a cell is species specific and self-directed. Who directs this growth? Is there somebody directing this growth? Is there some supernatural power which is directing the growth? Is there some out-of-the-world person directing the growth? Nobody is directing. It is a self-directed process. So from one zygote, you can have a small insect, or you can have a huge whale. The process is the same, and the process is similar, and that is the beauty. Nobody has ever been able to understand this process. All DNA in a zygote is depressingly alike. It absolutely looks similar in an ant or in a whale. If you do microscopic analysis, there is no difference in any kind of animal or any kind of living organisms. So the beauty is in nature, imagine nature. where I am talking of not just human beings, I'm talking of animals, I'm talking of fishes, I'm talking of sky, I'm talking of universe, nature. No space is too small and no task is too big. This is a very huge statement. You must carefully analyze and think about it. Animal embryogenesis is not only unknown, but it is unknowable. No human being can know how the embryo develops and grows. So we should know our limitations. We should know human limitations, and we should not think too much that we are huge, we are big, we are this and we are that, because there is somebody bigger than us. There is somebody sitting above who knows much more than what we know. We sometimes put fungi that no, they are not good, they are bad and this and that. But you must know that every living organism, every non-living organism has some role to play in the nature. When I was in kindergarten, there was a small little poem, little drops of water, little grains of sand, make the mighty ocean and the pleasant land. So everything is important and everything has a function. We should be alert enough that we should understand what the function is. We should be like a child. We should be like a child who's looking at the sky, who's looking at the stars and looking at the moon and looking at the universe and thinking about his future. We should have a childlike curiosity, sense of wonder, admiration and ignorance. You see, we should be like a child who looks ahead with wonder, with admiration as what beauty is there, and also realize how much ignorant he is. In nature's infinite book of secrecy, a little I can read. So we should, first thing is, we should bow down our head and do not think too much that we are too much and too big, because there are things and there are people and there is somebody who is much bigger than what we are. Brain is a cosmic phenomenon. Brain is a divine phenomenon. Do you know that all cerebral sulci and cortices are different in every human being like fingerprints? No cortex is similar in me and in anybody else. So like fingerprints, no two cerebral hemispheres are alike. It is a cosmic, it is a divine phenomenon. Brain is an expanded spinal cord. You see, this is the spinal cord and brain. It is an expanded spinal cord. And spinal cord is a miniaturized brain. There is too much in this. You see, I'm just giving you a sentence because of time factor, but there's too much this statement means to a neurosurgeon. Now you see this slide. This is about 12-week fetus. There is ear, there is nose, there are eyes, there are fingers, there are toes. And there is not a spicule of bone. There is no bone. Primacy of soft tissues. We must understand the soft tissues are stronger. Bone is the weakest part of the human body. You must realize this. Bone is the weakest part of human body. It does not give strength. It does not give shape, and it is not the primary process in the movement of a human body. So these bony vertebrae come later in fetus life. You see, the whole fluid is formed and then bony vertebrae are introduced. Bony vertebrae are discrete islands in an uninterrupted ocean of soft tissues. Huge sentence, huge. So some of these thoughts are introduced in my paper, Fluidity of Body. You must read this paper. Periosteum comes first. Bone comes later.
You have 3 more minutes. You have 3 more minutes, sir.
And the soft tissues are attached to the periosteum. Nothing is attached to the bone. A beautiful sentence for you. Bone is attached to nothing and nothing is attached to bone. It has huge clinical implication. I'm talking of clinical implication. Periosteum comes first, bone comes later. The strength of soft tissues is the strength of your spine. It is not the bone which is your strength. It is the soft tissue. You can strengthen your soft tissues by exercise, by running, by jogging, by all kinds of exercise and yoga. You can never strengthen your bones. Spinal cord does not pass through foramen magnum. See this beautiful sentence. Spinal cord does not pass through foramen magnum. It is the bone, or it is the foramen magnum which is formed around the spinal cord. Mandibular nerve does not pass through foramen ovale. Foramen ovale is fashioned around the mandibular nerve. Huge sentence. Huge sentence is clinically relevant, you must remember, and you can read more about this foramen fallacy in my article, where I mention that there is no hole in the body. There is no foramen in the body. There is no fascia. There is no hole in the fascia. Beautiful sentences for you. Skull does not contain brain. Skull is like a cap which is introduced over the brain. Vertebrae are like bangles over the spinal cord. It is the spinal cord which matters. Nerves which matter. Vertebrae they matter, but they are like bangles. They are like cosmesis. Believe me, these have huge clinical implications, and I will talk about that. So to be conscious that you are ignorant is a great step towards knowledge. We should bend our heads down and never keep our head in the sky. We are too minuscule if we want to learn and if we want to develop in the field of our neurosurgery. In nature, beautiful sentence for you. In nature, functional necessity is the mother of structural innovation. This sentence, believe me, why there is tail in a monkey and why there is no tail in a human body? Because of this functional need. Why cavernous sinus in a human body is smaller than cavernous sinus in a lion? Because of functional necessity. Why pineal gland is smaller in human being? Because of the functional needs. So functional needs result in structural innovation into a human body. Now I go to Arabic legacy. There is a beautiful sentence which I got from Arabic world, and I believe Nazia must have heard this sentence, but I introduced this word first time in neurosurgery about 30 years ago when I said from Arabic world that meninges are the mother of brain. Membranes come first, all the entire rest of the brain comes later. We should understand the power of meninges. Believe me, it has huge clinical implications, which I will discuss with you. And these are mentioned in my article. Membranes are mother, and truth is the embryonic plate. You see this is an astronaut, and it is flying. And this is a fetus, which is about 3 kg, and the mother is not feeling the weight because it is weightless. It is weightless because of the amniotic fluid, which keeps the fetus weightless. And you imagine the function of fluid is to keep the human body weightless. It is the water or the fluid which is making the mother tolerate the weight of this fetus. Similarly, our 1.5 kilogram of brain is weightless because of the fluid. It is floating in fluid. When it is 1,500 grams, only 50 grams is felt by the human body. When we stand, we are weightless because the entire body floats on water. And we should understand the power of water and the power of membranes. This beautiful eye is an ultimate of hydrodynamic system. The vitreous humor, the aqueous humor, the lens, and how the hydrodynamics is controlled and how the pressures are regulated in the eyeball is an ultimate in hydrodynamics and power of the water or fluids. And I wrote a beautiful article about the relationship of cavernous sinus in making the eyeball hydrodynamically the emperor of hydrodynamics. There was nothing mentioned in the literature about cavernous sinus and its function. I don't want to go too much in this because there are several articles of mine and you will like to read some of them if you are more interested as to what is the function of cavernous sinus, how cavernous sinus controls the body. You have never heard of cavernous sinus controlling the body. You have never heard of cavernous sinus controlling the pituitary gland. You have never heard of cavernous sinus regulating the body temperature. You have not heard of so many things about cavernous sinus and nobody has talked in the literature. You please read some of these articles. The relationship of cavernous sinus to the sphenoid sinus, relationship to the pituitary gland, relationship to the carotid artery, relationship to the air conditioner of the body. You know the mucosa is the most vascular structure. When the air goes, the temperature is cold or hot, but mucosa regulates, the turbinates regulate it and make it normal temperature. And that information goes to the cavernous sinus. When you eat or drink hot or cold, the mucosa regulates when it goes in the esophagus, it is normal temperature. How this normalizes and how it goes in cavernous sinus is a divine phenomena. We don't understand how the cavernous sinus controls the eye movements is an absolute miracle. So this pituitary gland, which is neither inside the brain nor outside the brain, has absolute functional necessity and absolute. Why thyroid gland is outside the just subcutaneous, why human testis is outside, has a functional role. We should understand, and these things have clinical relevance. On the basis of the fact that membranes are supreme, we must understand that tumors respect the membrane, and I have got at least 50 articles in the literature where I have discussed about the relationship of membranes with the tumor and how the tumors respect the membranes, how this cavernous hemangioma is entirely within the confines of membranes, how it respects the mother dura, and how we can do surgery inside the cavernous sinus if we understand mother dura. No matter how big this tumor will become, but the mother will be respected. And on the basis of this, for the first time in literature, we describe that intracavernous sinus tumors. Of course, I don't want to diminish the work of Vinko Dollens in describing about aneurysms and all, but mother membranes, if we understand, we can do this. For the first time in the literature, this was described, an interdural location. No matter how big tumor trigeminal becomes, but it will respect the membrane, and we describe for the first time in the literature interdural approach. And there are several articles of mine, as I mentioned, about dura and mother dura and how we should regulate the surgery. Which, if we are going to eye the skull base, we should understand the mother. And to understand the mother is not easy. Now I want to discuss another beautiful subject, divine subject called disc. Disc is divine. I have to give you one sentence. Disc can never go wrong. Herniation of disc, we should understand what is herniation of the disc. I am saying that herniation of the disc is a divine protection. You see, when we are standing on fluids. There is fluid in the joint. There is fluid under our heels. There is fluid in the disc. There is fluid under the brain. We are able to move. We are able to dance because of the fluid. Fluids make us weightless. Fluid makes us mobile. It should never be called intervertebral disc because the disc comes first, bone comes later. It should be called interdiscal body. And because it is much more stronger, much more powerful, it is water, it is life, it is divine, it can never go wrong. This is like ball and socket joint in a snake. It gives movement, fluidity, it gives movement, it gives weightlessness, it gives shape. This is a millipede without any bone. And you must remember, this is the most mobile structure, much mobile than human body. There is no, so what I'm saying is soft tissue, the fluid gives movement. Bone is not the movement. Bone does not give movement. This is cat. You have heard about catwalk. When a lady walks in a catwalk fashion, there is small amount of fluid, more amount of bone. So there is more less mobility in the spine. Mobility is a work of fluid. Mobility is the work of disc. When this aeroplane lands, you know what is the strongest part of the aeroplane? The air in the tires. If the plane lands on the tires, the plane will be okay. If the plane lands on the nose or on the wings, it will be shattered into pieces. What we don't see is the power of the plane, and what we don't see is the power of the human body. This lady is able to stand on the toes because of the power of fluids, and we should understand the dynamics of fluids and the dynamics of the disc. The music of movements. You please read this article of mine. It is a music, and you will love to read this article. So disc is the seat of strength, seat of shape, and seat of mobility of the human body. Also, disc is dynamic, and I have written in my several articles.
2 more minutes, sir.
Disc
2 more minutes.
Never go wrong. To make a human being making an artificial disc is essentially an entirely impossible thing to mimic what the divine or nature has made. So if the brain weighs in normal 1,400 grams, it is the CSF, it is the water bar that makes it weightless and makes us walk and talk without feeling the weight of our brain because of the fluidity of our body.
Professor Goel
plays a huge role.
Professor Goel?
Yeah?
Yes, you have 2 more minutes, sir.
I was given 20 minutes. If I have finished 20 minutes, I can stop because I don't think I have finished. I have not finished 15 minutes as yet. So can you confirm if I have 20 minutes? This is what I was told.
Dear Atul is 25 already. Sorry.
Okay. So I will stop here.
Stop your talk, and it's already 26 minutes.
Okay, Najia, I respect you. I respect the audience. I respect.
You still have 2 minutes to conclude, please.
Okay, so just beautiful few sentences I will make. That brain is nothing but sunken skin. So you please remember this sentence, and I will like to conclude because this topic of mine, which I had selected today on philosophy, was not easy for me. But when I was talking from my heart, my brain stopped functioning. I didn't think about time, and I was just enjoying to give my lecture. And I must say there are several beautiful things which I have not finished. If I had completed my lecture, it would have taken more than 1 hour. Now I realize. So next time, Najia, remember to call me to finish my lecture. And thank you very much for giving me this great opportunity to talk to the most accomplished ladies of the world and to give some philosophical note in a heart-to-heart talk. Thank you very much.
Thank you very much, Professor Goel. Beautiful talk. We would have wanted really to listen to everything. Unfortunately, we have this limitation of time. And my personal request is it possible to have all your publications on this matter? I don't know how to get a hold of that. Maybe I'll get your email address and send you a small note, and then we can get them in those papers. It's beautiful. Thank you so much for your presentation.
Thank you very much, and indeed a great honor and pleasure. Thank you.
Thank you. Let me call now the next speaker, Professor Sarah Woodrow. Professor Sarah Woodrow is Director of Spinal Neurosurgery, Department of Neurosurgery in Cleveland Clinic, Akron General. She's a chair of the educational committee, and she was also on the neurotrauma section of ANC and the CNS. She's a chair-elect ANS Women in Neurosurgery. Please, Professor Sarah Woodrow, we are very pleased to hear your talk, which title is The Need to Identify Both Mentors and Sponsors for Leadership Advancement. Thank you very much. Go ahead. Professor Sarah Woodrow.
Thank you so much. Can you hear me okay? Can you hear me okay?
Yes, I can hear you, no problem.
Perfect. So there's actually been a slight change in our topic. Our first speaker had an excellent talk on sponsorship and mentorship, so I decided to change it up a little bit. I don't think the new program got copied out, but I'm actually going to be talking on my experience becoming a leader, strategies for transitioning into new roles. And first of all, thank you very much for inviting me to speak at this very esteemed conference. I think we last met in Beijing almost 18 months ago. And while I'm missing the personal contact with this meeting, it certainly is encouraging to see the number of people who are attending virtually and how many more people we can reach out to in this fashion. Okay, so I thought I'd spend a little bit of time just talking about transitioning and leadership, with the idea that we talk about barriers for women in particular, making these types of transitions, steps to prepare for leadership roles, identifying options both internally and externally for leadership success, as well as strategies to succeed once we identify those. I thought I'd start just a quick second talking a little bit about myself. So I am Canadian, born and bred. I trained in neurosurgery in Toronto, Canada, and then transitioned to the University of Miami for a fellowship in spinal surgery. And I've good, bad, or otherwise, I've remained in the US ever since. I took my first job in Southern Jersey at a very, very busy trauma center. And from that, I was recruited to the University of Kansas after about 3 years, where I practiced for 7 years, and most recently transitioned to the Cleveland Clinic just prior to COVID starting, where I'm director of spine surgery at one of their peripheral hospitals. So I feel a little bit uniquely qualified to talk about transitioning in practice and in leadership roles, because I've had several transitions through my relatively short 10-year career. And on top of Canada being my primary home, and now the US my secondary home, I consider Ethiopia my third home. I work with FEANS and work over in Addis Ababa regularly, teaching in the training programs over there. I have 2 children. Harley is my little white Maltese, and Penfield, named after the forefather of Canadian surgery, is my youngest and spunkiest of children. Okay. So just starting off, when is it the right time to transition to leadership roles? And I think for everyone, obviously, it's different. In some cases, it is very glaringly obvious that things aren't working out in the position that you're in. You could be unhappy, you could be burnt out. There could be conflict amongst your team or demoralized from leadership. And certainly I had elements of that in my first job, being in a very busy trauma center where we were constantly stretched to the limit. But more often than not, it's not so obvious. It's a nagging feeling that you think it's time to get out of your current position to think about other opportunities. You may feel a lack of support. You may become bored or disengaged with your colleagues and your patients, or you may just feel an overall lack of growth and challenge. And when you start having those feelings, I think it's time to check in with your colleagues, with your family, and sort of talk through situations and what opportunities may arise beyond where you're at. That said, I think over the last 10 or 15 years, there's been a lot of literature coming primarily from the business world that looks at barriers for women to transition to these leadership roles. And I'd like to spend a couple minutes discussing some of these barriers. So risk aversion. I think in general in life as women, we tend to be safer in our choices. For whatever reason, in whatever society, we tend to take not as much risk. And this certainly translates when we're talking about jobs. And if you look at the business world, and in particular, if you ever read this book by Sheryl Sandberg, women, when they're applying for leadership positions or positions in general, will only apply if they think they have 100% of the qualifications checked. If they don't, they decide not to apply. Men, on the other hand, tend to apply even if they don't have all the boxes checked. If they don't feel completely qualified, they're like, well, I have most of them, let's give it a shot. Women tend to play it more safely. The other thing women tend to do is they tend to overvalue expertise. We develop this, what we call mastery mindset. And we believe that how we get recognized is by mastering our jobs. If we keep our head to the ground, keep working hard, that we will eventually be recognized for what we contribute, and we will be naturally allowed to rise in positions. And the reality of it is it doesn't matter, particularly as neurosurgery, how good a spine surgeon I am, how good a skull-based surgeon someone may be. Those are obviously very important things for what we do, but when we talk about leadership roles in particular, those may not be so relevant. Instead, you get recognition from networking and becoming visible within your peer group and beyond. Once people know you and your work, that's when you start being a natural candidate for some of these positions. When you speak with expertise at conferences, again, you're increasing your notoriety and you're becoming more well-known, setting yourself up for these types of leadership roles. And ultimately believing that you yourself can contribute to a higher level is really at the center of this all. Looking for, so related to this, is data that comes out of the business world as well as the medical field, that women need encouragement to apply for senior positions. In other words, we often sit around waiting to apply to some leadership positions as opposed to seeking them out on our own. We wait for our peers, our mentors to recommend us to go as opposed to going on our own. That leads to something that was labeled the tiara syndrome. If any of you have time and take a look at this blog, it describes it quite nicely, where we all think that by performing excellently in our current positions, it will lead to obvious gain, and it doesn't always. In general, women are socialized to be more loyal, and we're loyal to our families, to our friends, to our institutions and our team. And as a result, we tend not to pursue these other opportunities. We put others first. We don't want to inconvenience other people if we decide to leave a position. So we hang on a bit longer than perhaps we should at times for the sake of others and not for ourselves. It's time that we recognize these types of factors within ourselves as we start looking at ways in which to fulfill our own wishes and goals. And then women, more than men, tend to have to coordinate with their families and with their spouses. Still to this day in North America, and I'm sure many other countries represented on this conference, women are more likely to have a spouse who's also in a prominent professional role. And as a result, when we're talking about transitioning to other jobs, especially if they involve a move, this has to be taken into consideration. I can speak from personal experience in my recent move. My husband, who's a high school administrator and educator, ultimately gave up his position so that we could make this role for my own career. Now he's since gone back to the classroom and is teaching math and is quite happy with that. But that in of itself involves quite a bit of a negotiation between the two of us. So once you start thinking about transitioning to a different leadership type role, what are the things that you can do to try and prepare yourself for that? Well, I think first and foremost, you go to your mentorship team. You start asking the people who have helped guide you so far through your career, where to look, how to better prepare. And this involves not just looking at mentors internally within your own institution, because they may have some alternative goals that not encouraging you to look elsewhere, but also externally. And I think really important as part of that is networking and intentionally broadening your network to look for other opportunities that might engage you. Naturally, the place to look is in our professional societies. So that for us in North America, the AANS or the CAANS, the WFNS, obviously internationally, but each of us has our own local society that we can certainly start talking to and with individuals there, looking for opportunities. And as well, these days with the internet being so prominent in our lives, at least in North America, there's a number of different women's networking groups that I've become part of. Women in Neurosurgery is the obvious one, but I've also joined a women physician in leadership group, a women in surgery support group, and each of these groups represents a diverse interest group of women who, like myself, have various amounts of experience and are looking for different leadership positions. And those are the places to start if you're starting to think about moving on to other areas. shooting out quick links to people, what's out there, or is there a position available, or advertising a position or a role locally is a great way to encourage each other in looking into these types of transitions. The next thing you need to do is to think about the skills that you need to develop. Just like neurosurgery, leadership is not a natural thing. For some people are certainly more natural leaders than others, but there's a whole skill set involved with becoming a leader. And I think all of us can constantly be introspective and learn from our own mistakes and from our own experiences how to make things better the next time around. In North America, there's several leadership courses that are available either through the American Association of Medical Colleges. Harvard has an excellent one targeting women physicians that can be done online now. And these all have fabulous lectures and resources on a number of different skill sets that are required to become an effective leader. The other way you can gain some experience is by engaging in other roles. So all of us at our local institutions or in our local professional societies have committees, task forces that we can use to engage in, both to serve ourselves personally and professionally, but also to gain some of the experiences in developing these leadership skills. It also gives you some insight into how institutions or societies function structurally, which again will help you in your future as a leader. And lastly, there are dozens now of leadership development books out there. Some are geared more towards the medical field. Most are a lot more general. These are some of my more favorite ones that I would encourage people to read, and you'll find ideas throughout all of these books that will resonate really closely with you as you start reflecting on your own leadership style. Promoting yourself. So I'm going to confess that I am lousy at doing this, but I think it's really important for anyone who wants to evolve into a leadership role to get used to promoting yourself. So you start initially with your chair or your chief. Make sure the people you report to understand what your overall career goals are, so they can help direct you in the right way. It's important to mention yourself when you're giving talks at lectures like this, internationally or locally. Most of us have done other work in similar fields, and by mentioning the paper you published on a relevant topic is not egotistical, it's giving yourself credit, and it's important for us to be our own promoters that way. It's also important for your institution's leadership to be aware of this. So beyond your chair, your chief, but the president of the hospital or the medical director. And it doesn't necessarily involve just neurosurgery. For example, if you say to one of them, I'm passionate about medical education, if there's an opportunity to expand my leadership role in this domain, please think of me. I'd love to be part of the medical school. If that's what your passion is, then get out there and talk to the people who make some of those decisions. And we always talk about an elevator speech in North America. That's a 30-second or 1-minute little speech about yourself that targets not just who you are, but where you want to go with what you've got. And these are important little dialogues to have ready for yourself when you're at networking events, to highlight yourself and just put yourself out there in the minds of people who are making some of those decisions. And then beyond your institution, there's other ways to promote yourself. So social media is certainly very, very common here in the US. And imagine there may be some different venues as well locally for many of you, but having a presence on social media, having a professional page, as many people do, does help spread your word. Getting involved in the community, organizations like Headstrong, Think First, are organizations that are organized in the community to help with trauma injury or brain tumor treatments, and talking with those local leaders, again, just gets yourself out there and gives you a whole different experience that you can also put towards your leadership development. And then of course, the obvious, submitting abstracts to local neurosurgical meetings, to the WFNS meetings when we're allowed to reconvene. These are all important ways of getting yourself recognized nationally, internationally, within our own profession. So as you work on your skills, then you need to start looking at leadership options. And I think it's really critical that you have to be very conscious of who you are, what your passion is, what are your strengths as you start looking at some of these roles. The easiest way to start this examination is looking through your own network of people, whether it's locally in your own institution or if it's nationally across the country or across the region. But if you start talking to people that you know and make them aware that you're interested in education, for example, that you're a spine surgeon, some opportunities may present themselves, but you need to keep discussing it with people and make sure you have a good vision of what you're looking for, because that will also help one person put you in contact with another person who may actually have your dream job. It's also important.
You have 1 more minute remaining.
Okay, I will hurry it up. Also look internally. So make sure you know what's going on in the institution, not necessarily even just at the local institution, but there might be some satellite positions available. Once you see positions that you want, make sure you apply, make sure your CV reflects the position. In other words, make it a unique CV that represents leadership if you're looking for a leadership position, and make sure you prepare for those interviews once you get them. When you get an offer on the table, make sure you review the offer carefully and think beyond salary. When we're talking about leadership position, it's a lot more to it than simply salary. You need space, you need assistance, you need departmental funding, and you need time to do all that, and make sure that's part of that negotiation. And then lastly, if you're going to leave a position, keep in mind neurosurgery is a really, really small world. Even though we have 100 neurosurgeons on this call, I know about a dozen of them. And you want to make sure you don't burn your bridges as you leave. And finally, don't give up. If you don't get the position, learn from the experience, reflect on why you may not have gotten it, discuss it with your mentors and sponsors, and move on. Keep at it. Thank you.
Thank you so much. Thank you very much. This splendid and excellent talk, Professor Sarah Woodrow. I've learned a lot of things. This doesn't apply only for women neurosurgeons, but also for men.
Absolutely.
And for everybody. Basically, what I've written is that you have to be proactive. You have to be prepared also to be a leader, and also you have to learn how to lobby. That's very, very important. I like it because basically you show the how to do to become a leader, not sitting just waiting. It's a matter of being proactive. Thank you so much for your talk. I'm calling Professor Lynn Lucena.
Yes, I'm here.
Yes, from Philippines. Professor Lynn Lucena is from Philippines. I hope I'm pronouncing very well your name. Please correct me.
Yes, you are.
Thank you. She's a chair, Philippine Board of Neurosurgical Surgery. She's a secretary of Board of Directors of Academy of Filipino Neurosurgeons. She's a member of WFNS, WHO Liaison Committee on Global Neurosurgery, a member of Women Neurosurgery in ACNS. You are going to talk to us about task sharing, task shifting model in neurotrauma, addressing the scarcity of neurosurgeons in the Philippines. Please, Professor Lynn Lucena, please go ahead.
Okay, I need to share my screen for a while. Sorry. Share screen.
Okay.
Okay.
Excellent. You have 15 minutes starting now.
Yeah. Can you see my screen, or is that?
Yes, you can see your screen.
Okay. So, okay. Yeah, you have already introduced me. So I'll go directly to my talk. Thank you so much again for the host, Professor El Abbadi, Professor Souad Bakhti, and also Professor Isabelle Germano for inviting me. So as we can see, this is the World Federation Neurosurgery Global Neurosurgery Workforce Map. we can see that there's a lot of need for neurosurgeons, especially in the areas of Southeast Asia and Sub-Saharan Africa. So we need more than 23,000 neurosurgeons in the low to middle income countries, and 5 million essential neurosurgical cases are untreated each year. So the ratio for this is actually, you have Sub-Saharan Africa and Southeast Asia, 0.01 neurosurgeons per 100,000. And the expected ratio is supposed to be 1 per 100,000. In the Philippines, we have 0.108 per 100,000. And in Bicol, where I am practicing right now, it's 0.05 per 100,000. Okay, so in 2017, it was identified that the global burden of disease, 195 million new cases of road injuries worldwide. Majority are secondary to motor vehicle and motorcycle accidents. In the Philippines, the trend has increased from 65,000 cases in 2005 to 110,000 cases in 2017, occurring in the capital region, capital city of Metro Manila alone. Then among these, the 15 to 29 years of age, they are the leading cause of death globally, even higher than HIV and other infectious diseases. So in the Philippines, we have an estimated population of 109 million with an archipelago of more than 7,000 islands. We have 4.8 of 8.7 million vehicles, which are motorcycles. So as I said, there was a 45.76% increase in deaths from road crashes from 2006 to 2015. And road traffic deaths are the leading cause in less than 24 years of age. So 2016, 1.2 million injuries, 10,000 deaths. In 2019, I did a survey of the 10 training institutions of neurosurgery. On the average, there's 80 to 100 cases of traumatic brain injury per month, with a mortality of severe TBI at 80 to 90%. Disability includes post-concussive syndrome in the mild traumatic brain injury in 20 to 30%. So this is the demographic distribution and geographic distribution of the fellows of Academy of Filipino Neurosurgeons in the Philippines. So we have, right now, we already increased to 145 fellows with 51 in Metro Manila. And then there are 10 training institutions in neurosurgery, 8 are in the capital region of Manila. So here in Bicol region, we don't have a training institution. The population is 5.8 million. There's around 1,200 cases of traumatic brain injury per year. 6% are surgical, and we have 2 tertiary government hospitals with 250 to 300 bed capacity with ICU and scan. And neurologists, there are 7 adult and 3 pedia neuro. Neurosurgeon is me, 1 permanent government neurosurgeon. So with this scarcity of workforce, multiple approaches have been suggested. So like short-term missions, training camps, twinning, and the other one, which I will discuss, is task shifting or task sharing. So what is this? When you have task shifting, you delegate the task to existing or new groups with less or narrowly tailored training. The new task owner will then have clinical autonomy over the patient care. But when you have task sharing, the workplace strategies are built upon the collective input of the health team, and their shared responsibility and autonomy over the patient care, or the more qualified individual will maintain the responsibility. So theoretically, you have supposed to have a structured training curriculum, you need to have oversight, and you need to have competence-based evaluation. You need to integrate this into the workforce and with an appropriate referral network. And you have to have a defined scope of practice in order to prevent task creep. You also need to maintain certification. You have to have some financial compensation. And this has to be recognized by your health system, and there should be room for professional development. So in the Philippines, what do? we have general surgery residents who undergo 3 months, but now I made it 6 months, when they approach the year level 2 to year level 5. They should rotate in neurosurgery for around 3 to 6 months. They go to all neurosurgical cases. They consult with neurosurgeons like me, the consultant on phone and via text and Viber. And the autonomy is progressing. So the focus will be the medical and surgical management for trauma. There should be regular feedback on rounds and conferences. And promotion should be based on competency. So this is me with my trainees doing some neurosurgical work. Okay, so the study was done based on a retrospective logbook review from 2015 of June to 2018. They included patients with traumatic brain injury, and we collected information on patient demographics, diagnosis, treatment interventions, and clinical outcomes. The analysis was done by chi-square and multivariable regression analysis. Primary outcome was the mortality. Secondary outcomes were the inpatient infections, length of stay, and the change in GCS from admission to discharge on these patients. So these are the results. We had 3,241 cases, 2,233 at the government hospital, 1,008 at the private hospital. Surgery was done for 214 admissions, which is actually amounting to 6.6%, which is comparable to high-income country rates. So the neurosurgeons mentioned here are the consultants, or the ones who have already been diplomates and fellows. And the task sharers are the general surgery residents. Okay, so neurosurgeons handled more the private, the older age patients, and the mechanism of injury was more to fall. And CT scan was done the same day, and if ventilation was needed, it was received. Whereas the task sharers mainly operated on public or government hospital patients, road traffic accidents, hyperosmolar medications was given, ambubaging, not ventilator, was usually done, and ICU was usually not received. Okay, so multivariable regression was done, and the predictors were subjected to multivariable regression. These are the results. As you can see, the mortality, the length of hospital stay, and the change in GCS is comparable between the neurosurgeons and the task sharers. And with this, conclusion was done that this retrospective cohort study is one of the first to thoroughly examine the quality of task sharing and shifting care provision in neurosurgery. It also demonstrates that emergency neurosurgical care can be delivered safely using a carefully designed task sharing and shifting model. So future directions, we need to collect more data, and more formal approaches should be done to emphasize task sharing and shifting for these programs. Okay. So publications was already done. This study was already published, and I also did write-up on the World Federation of Neurosurgical Societies last December 25, 2018 about this. Okay, the main author is actually Dr. Faith Robertson. She's in Massachusetts, MassGen now as a neurosurgery resident. And we are here with Dr. Michael Lawton, who visited us in the Philippines sometime in 2018. So these are the references. And I would like to thank everyone for your attention.
Thank you so much. Thank you very much, Professor Lynn Rusena, for this interesting talk. And thank you for finishing in time. I think you still had, something like 5 minutes. That's very good. Excellent for getting time. And I like your model because I worked in Zimbabwe in the second city called Bulawayo, and I was the only neurosurgeon for 2 million people, 2 or 3 million people. And I did exactly the same by allowing general surgeons to rotate into neurosurgery and do also the calls. First of all, I had the time also to sleep. And but when I compared their results, they were exactly the same as mine. And the following day, in fact, I would take over those patients who were operated by general surgeon. It was really fantastic, and difficult cases, of course, they will call me. I think it's a very good model for overcrowded countries. I mean, population, particularly in third world countries or developing countries, so that these facility can be extended to many patients. Thank you so much.
Thank you also.
Okay. Thank you. Let me call Professor Shinichi Yoshimura from Japan.
Hi.
Hi.
Okay.
Good evening. Yes.
Oh, excellent. Thank you for talking, because I didn't know whether it was a lady or a gentleman.
No problem. I'm very happy to be invited to this very important meeting, Najia and the others. Thank you very much for inviting me.
Yeah, let me just say a few words from you, that you are professor and chairman, Department of Neurosurgery on Hyogo College of Medicine, Hyogo, Japan. And you are chairman of Stroke Center, Hyogo College of Medicine. You are chief editor of Journal of Neuroendovascular Therapy. And you are going to talk to us about hybrid neurosurgery for cerebrovascular diseases. Thank you very much. Please go ahead, Professor.
Thank you very much. Okay, I'm going to talk about today's topic, hybrid neurosurgery for cerebrovascular diseases. This is our operation number. Number of operation is increasing year by year. Among them, the most frequent one is cerebral aneurysm treatment. As you see, recently endovascular treatment is increasing. You may know this first developed flow diverter pipeline. I'd like to share my typical case treated by this device. This patient is a 55 years old male. Actually, he is a radiologist. He noticed left visual disturbance, and he performed MRI by himself and diagnosed as a supracellular mass lesion. MRI showed a large cerebral aneurysm like this, and he investigated others and requested me to treat this one without any coils because it has already a mass effect. So I followed his advice, and the aneurysm was treated by pipeline only. And this is before the treatment, and 9 months later, it was gone. And also visual disturbance was completely improved. I was so happy to know that. This is a brief summary of our experience of flow diverters. Total number was 152. And as you see, max diameter of the aneurysm was 12, relatively large. And recently, we performed this treatment under local anesthesia. And please look at our results. Modifier ranking 0 to 2 was in 98.7%, very high, very safe treatment. And also, this graph shows the changes of modified ranking scale. Fortunately, independent patient rate increased by time after flow diverter treatment. So large or giant aneurysm can be treated safely using this device recently. However, on the other hand, there are some difficult factors for this treatment. Giant aneurysm, tortuous access route, fusiform or branching from the dome, ruptured aneurysm, especially acute phase, and hemorrhagic diseases like gastrointestinal or other diseases. So let's look at giant aneurysm data. This graph shows the relationship between aneurysm size and complication. When we look at the small or large aneurysm, the complication rate is not so high, 5% or less. But in giant aneurysm, complication rate is much higher than the others, like this, 25%. And also spontaneous delayed rupture was also observed in 5.8% in giant cases. So we have to care when we treat giant aneurysm with flow diverter. Recently, new flow diverter was introduced. This new one is called as Fahd. It has a dual layer fine mesh, and the indication was widened for MCA and ACA basilar artery, and also for small aneurysm, including fusiform one. Please look at this case treated by new flow diverter Fahd. This patient was an 80 years old female having dementia due to compression of the giant thrombus aneurysms to the brain. So we decided to treat this one firstly with coils like this, and afterwards deploy the Fahd. You can see stent mesh like this, and finished. It was done within 1 hour under local anesthesia. Look at this. 1 year later, aneurysm was completely thrombosed, and the total size was smaller compared to just after the treatment. And the surrounding edema is decreasing. This right side shows 1 year later MRI. The edema was decreasing, and I'm happy to know that her dementia is also improving. Next one is a fusiform or branching. Look at this. This 80 years old female having a growing left MC giant aneurysm. This is tough one. Look at this. MR proximal part was too short to clip, and distal part was only 2 millimeter in size. And this giant aneurysm has another problem. Anterior corridor artery and PCOM seemed to adhere to the dome, so it is not good for clipping. How to treat this giant fusiform aneurysm? It should have perforators like this. So clipping, okay, but the risk of intraoperative rupture is high, and also the rate of injury of anterior corridor artery is also high. Stent or flow diverter assist coiling. It is not difficult to perform, as you see in the previous case. Deploy stent or flow diverter and coil. Technically, it's easy. But in this case, the distal MCA was small, so the risk of thrombosis is high. So how about bypass and trap? It's well-established method, but if there are perforators from the dome, their occlusion lead to hemparesis. If there are many perforators distal to the aneurysm, we may be able to clip, trap the aneurysm. But in this very case, another problem is that there is no space to insert a clip at the MR proximal part. So after clipping, clip may slip out like this. It leads to the stenosis of the ICA. So I thought that the bypass and the coiling might be the best way. Please look at the real operation. Firstly, we carefully incise the scalp and harvested the STA branch. And after making a bone window, we carefully divided the Sylvian fissure. And I was so happy to look at this. There are many perforators from the distal part, the M1-2 part, distal to the aneurysm. So I decided to perform bypass and coiling in this single operation. After bypassing, I temporarily clipped the distal M1 and confirmed the patency of the bypass, and the angiography was performed because this operation was done in hybrid operation room. So we confirmed the patency of the bypass. So immediately we navigated the microcatheter and simply embolized aneurysm with many coils. It's technically easy, like this. Okay. After that, final angiography showed the complete disappearance of the aneurysm and bypass patency. This is the post-operative MRI showing a small infarction at the basal ganglia, but luckily she recovered completely. Look at this, didn't have any hemparesis, no motor aphasia. She's going to be a nurse. I am so happy. However, in case of bifurcation aneurysm, things is different. We may be able to embolize the aneurysm with Y or T stent. I prefer T stent to avoid complication like this. However, when we look at the vessel from this direction, the vessel is gelled with stent mesh. So this mesh may cause thrombosis, so we cannot stop antiplatelet for life. Flow diverter, it may easy, but the gelled branch will be also thrombosed together with the aneurysm. So recently, new devices were developed. One of them is this pulse rider to support the coil at the neck like this. This is the first case of pulse rider in our department. And the next one is WAVE. It's called as intrasacral flow diverter. This can be applied for basilar chip or ACOM or MCA. So treatment selection at the 4 years ago was like this: 56% were endovascular therapy, but it increased up to around 70%. So annual trend of annual treatment in our country is like this. The lower two shows endovascular therapy. It's almost same, right? So endovascular therapy is increasing. 10 to 20 years ago, it was like this. Surgery was much stronger than endovascular therapy. But now it is like this. So it's time to shake hands, or it's time to be a hybrid neurosurgeon. This samurai has two swords, surgery sword and endovascular sword. Is it possible? Yes, nothing is possible to achieve. You can be hybrid neurosurgeon. We are proud to be a WFNS postgraduate training center, and we have been receiving many training visitors from many countries, like this, even from Africa and New Zealand. And I'd like to introduce a current co-worker.
We don't heard.
I came here to be a hybrid neurosurgeon.
Great. We hope you can be a good neurosurgeon.
I hope so.
Okay. Just slowly pushing.
She's embracing the aneurysm, echomaneurysm.
Switch to okay, very good.
Okay. So this is my message. Hybrid neurosurgeons can treat almost all cerebrovascular disease safely, including complex ones. Women neurosurgeons are always welcome to join. Thank you for your attention.
Thank you very much, Professor Yoshimura. This is very, very interesting and a strong message. I think a neurosurgeon, well-accomplished neurosurgeon, has to be like a commando in the army. It means whatever war you bring, they should be able to fight it. And it also emphasizes the teamwork, so that neurosurgeons can work with neuroradiologists, or neurosurgeons can learn all those techniques so that they can do all those treatments on their own. That's beautiful and wonderful. And thank you very much also for keeping the time.
Thank you.
I'm sure there will be a lot of questions later on. Let's go ahead. Let me introduce Professor Gail Rousseau. She's a very good friend of mine. Professor Gail Rousseau is a clinical professor of neurosurgery in George Washington University in Washington, USA. And she's going to talk to us about progress of women in neurosurgery, recent publications. Professor Gail Rousseau, please go ahead.
Great.
Merci beaucoup d'être là.
Thank you so much, Kazadi. Can you hear me?
Absolutely, very
see
well.
My slides? And see my slides?
Not yet.
Oh dear. Okay, let's try that again then.
Take your time.
Let's see.
I can give you 30 seconds.
I'll make sure that we make up some time here. Let's see. I'll make up the time. I think you might need to stop sharing from the previous speaker. That's what happened. Are you able to do that?
Yeah.
And now can you see my slides?
Excellent. Yes, I can see. Perfect.
Okay,
I can see everything.
Thank you. Well,
okay,
thank you.
Now, start.
Thanks very much. And I will make up some time for you all.
Merci beaucoup.
It's de rien, mon cher. It's really a pleasure to be with all of you. I'm honored to participate in this really superb webinar. So I congratulate Najia and Souad and Isabelle Germano for putting it together. And although I know that there's been a lot of talk about how difficult things are, I'd like to just say that we should take a moment to celebrate that we have, well over 125 people listening to outstanding women from around the world give their perspective on neurosurgery. And I think this is a first, but it won't be the last, as Aruna Ganju said. And better is good, right? We may not be where we want to be, but we're ahead of where we were before. I'd like to talk about diversity in neurosurgery, and certainly we're focusing on women in neurosurgery because of the theme of this meeting today, but I'll bring up some other issues that I think are equally important in our increasingly global world. And we published on this last year, and I've become really quite passionate about the benefits that will accrue to the specialty we all love if we are deliberate in making it a diverse and welcoming specialty. There are a couple things we all agree on. We agree we need the best possible people in neurosurgery. And what I'd like to demonstrate briefly is that there's good evidence that a key driver of excellence and innovation in any field is diversification. So I'm going to quickly just go through some of the highlights of women in neurosurgery. Many of these have been touched on by other excellent speakers before me. Neurosurgery, you could say, had some diversity from the beginning, because in this early picture of our society, the AANS, you can see Louise Eisenhardt. But as you know, she was not a neurosurgeon, but a neuropathologist, made great contributions. And then you've heard about the early pioneers from the UK, Romania, the first board certified woman from Turkey. And I'm pleased that the first board certified woman neurosurgeon in the US was Ruth Jacobi from my own institution of GW. And then around the world, we've had superb women neurosurgeons who've led the way, including our own Najia, the first woman professor of neurosurgery in Africa. And look at these youngsters, this group, Women in Neurosurgery, who first got together in 1989. And I would say that I do agree with the earlier speakers who have noted that this kind of gathering together of identity groups like the Women in Neurosurgery group has been a very powerful, important, and effective forum for networking and for career advancement. You've seen from Professor Ganju this early paper on the future of neurosurgery. Our progress wasn't completely rapid. The picture I just showed you on the formation of women in neurosurgery was from 1989, but by 2008, our group had grown in enough force to attract the attention of the AANS Board of Directors. This paper was written, and it was recognized the need for active measures to ensure that every neurosurgeon enjoys the opportunities by dismantling barriers, giving a hand across the remaining gulfs that separate the privileged from the deserving. And this was a editorial written by the then president of the AANS, Jim Bean, in 2008. And it's as true now in 2021 as it was then. And it's up to us to activate that. You've seen this slide also as well from the Redux that was written 20 years later. We have a long way to go before we achieve parity in neurosurgery with our gender, racial, religious, and other diverse groups in the population. But we are making progress. This seminar, as I've said, or webinar, I should say, is an example of that progress. The World Federation of Neurosurgical Societies has helped move the women forward and given us a forum to be able to make a difference. The European Association of Neurosurgical Societies is doing the same much more recently. What I'd really like to focus on is something that Kate Drummond talked about in her talk a couple hours ago, and that was the tremendous activity that has happened during this pandemic in terms of women neurosurgeons claiming and recounting our history in order to move into the next 100 years, the next century of neurosurgery with more equity. So as one of a number of papers that we wrote looking at the first 100 years of neurosurgery, one of them was on the contributions of American women neurosurgeons. And this seemed to touch a tender chord around the world, as you've heard from Kate Drummond. And we developed writing groups on women neurosurgeons on every continent. I want to point out to you this early paper, the single author paper by Robert Spetzer, one of his very few single author papers that was published in the Asian Journal of Neurosurgery in 2011, in which Dr. Spetzer said that the scant historical literature devoted to women in the field of neurosurgery suggests not that their contributions are less worthy than those of their male counterparts, as much as that their contributions have yet to be fully recounted. So now, a decade later, in 2021, my focus here is to show you that those contributions are being recounted, and they're being recounted by women on every continent. So what you have now is 8 papers that were published in the March issue of Journal of Clinical Neuroscience. Here's an early preprint from Kate Drummond's paper with 15 co-authors on the contributions of women neurosurgeons in Asia and Australasia. We want to all be familiar with our own history and celebrate the accomplishments of our peers. Likewise, that process led to 3 papers coming out from the working group in Europe. The first female neurosurgeons, the 4 Athenas, came out of this group, as well as a 2-part article reviewing the chronology of trailblazing women neurosurgeons in Europe. There are some living legends there that we can all tap into, and we all need to know our own history in order to be able to build upon our forebears. In the Middle East, we had an outstanding writing group that published this paper, and I would recommend it to all of you, and that was under the leadership of Professor Farida Najat. And in Latin America, Central and Latin America, we had an outstanding effort under the leadership of Nelci Zanon and so many others who put together this wonderful article. And then there's a manuscript in progress to highlight Canadian women as well that you'll see hitting our peer-reviewed publications very soon. So the point that I'm making here is that in order to fully embrace our role as leaders in the next century of neurosurgery, we need to be familiar with our history. The Journal of Neurosurgery likewise gave us all an opportunity to publish. I'm very proud to have been co-editor of this March issue that was devoted to international women leaders in neurosurgery, past, present, and some more future, that has Alexa Canaday on its cover. I commend this to you. This should be, I think, required reading for any woman in neurosurgery today, because the scholarship is extraordinary in those papers that were presented. And then related to these landmark historical papers are just want to show a series of papers also published during the pandemic that show what happens to women first authors when women are mentors, and when we work together and involve younger people, this is what happens. So it's really important. It's essential to benefit our society to have all voices be heard. So I've just summarized briefly the contributions of women neurosurgeons around the world, but we do need to talk more about gender minorities, immigrants, and geographic transplants. Think of all of those outstanding neurosurgeons you know, whose ability to get through the challenges of a neurosurgical career came in large part from the resilience that they developed as a result of being immigrants themselves, or these neurosurgeons who live with a diversity, physical diversities, operating from a wheelchair, or operating when one has a stutter. These should not be reasons to not have talented people become neurosurgeons. And then finally, what about ageism? I just ask you all, whether young, middle-aged, or getting older, to think about what happens in neurosurgery, where we now have the first generation of people who are likely to live with health and financial resources, if you're a neurosurgeon past age 65, and a love for neurosurgical education. What more could or should we be doing to develop encore careers so that we can start to narrow that gap between the number of neurosurgeons the world has and needs? And then finally, as I move to close, I just want to talk in general about why diversity makes sense. We've learned from the world of business, where it's not just about being nice, but it's about making money, that companies with above average diversity actually report higher revenues. This is from Boston Consulting Group, but every major consulting group can give that same data. Or if you look at economic theory, portfolio diversification. We all try to do that. Well, it seems amazing, since that is almost intuitive, that we should diversify our portfolios, but that actually was a science that needed to be studied, and it won a Nobel Prize in economics for Harry Markowitz. And it said that the more types of investments a person has, the more likely they are to have a net gain with lower risk. That's what we want for neurosurgery. So if you look at the proponents of portfolio diversification across the top of this screen, doesn't look like a very diverse group, does it? But I'm happy to say that the lower group, which does look diverse, are also today's experts in portfolio diversification. There's something to be said for it, and we in neurosurgery want to learn from that discipline. And then finally, what about the world of ecology? And is it merely chance that there are estimated to be over 5 million different species of life on Earth? Or is there perhaps some Darwinian advantage that's conferred to nature by that diversity? And there are just too numerous to mention articles that show that biodiversity improves the performance of a system, it enhances productivity and stability, and improves resilience. If we put this evidence together, we look at not only our own history in neurosurgery, but if we look at other systems, ecology, economics, we know we need the best possible people, male, female, different race, different abilities, blue, green, yellow. We need the best people in neurosurgery. And I think the evidence suggests, in fact, the evidence shows and demonstrates conclusively that excellence, innovation, and strength are greatest with diversification. So I'd like with that to thank my very diverse team that is constantly working on this issue of diversity in surgery. This is a diverse team by terms of age, race, gender preference, ethnicity, religion, and I'm so proud of all of them. And I also want to give a shout out to my good friend, Sean Hervey-Jumper, who is our reviewing author on our initial paper on this. And then finally, I want to thank non-neurosurgeons who have illustrated these issues for us. Javier Yep, who is Peruvian, but when getting his master's thesis in graphic design in the United States, designed this Unity and Diversity flag, which we use with his permission. And also Jeff Hansen, who is an artist, a philanthropist, and also a neurosurgical patient who paints in this very brilliant way with high image diversity and high contrast because he has neurofibromatosis and bilateral optic nerve gliomas. So with that, I want to just join the ranks of many women who've presented and men who've presented today. It's a diverse group that I think shows very well that we do benefit from recruiting and supporting a diverse group in neurosurgery. With that, thank you very much.
Thank you very much, Gail, for keeping the time. Thank you very much for the great talk. I really enjoyed it, and we all enjoyed it. And this is really very good. And I'm sure there will be a lot of questions. And after the session, let's carry on. Let me call Dr. Nqobile Thango from Cape Town. She's a pediatric neurosurgeon at Red Cross War Memorial Children's Hospital, Cape Town. She's a lecturer in Division of Neurosurgery, University of Cape Town in South Africa. She's a CAANS Young African Neurosurgeon, and she's in that forum. Nqobile, welcome, and please go ahead.
Thank you so much. Okay, let me unmute myself. Thank you very much, Professor Kalangu. Hope my slides project well, and keeping in the culture of WIN, my presentation is short and sweet. So firstly, I'd just like to say thank you to the organizing committee, Professor Najia, Souad, Professor Isabelle, and Fahd for the invitation. And today I'll be speaking on the role of young neurosurgeons in global surgery. So my first disclaimer would probably be I'm proudly a woman in neurosurgery, but furthermore, I'm proudly an African woman in neurosurgery. And firstly, I'd like to acknowledge that women in neurosurgery are privileged to receive mentorship and support from Africa's leading female academics and international icons, Prof. Souad and Prof. Niger. And under the leadership of Claire, this organization has really grown, with mentorship being at the center of it. And later on, Claire will be presenting her paper on the history of African neurosurgeons. When I move on, I'm also part of the Young African Neurosurgeons Forum, and this is a subcommittee in CAANS, and under the leadership of CAANS President Prof. Qureshi and Chair of YNF Ignatius, we have a group of passionate, hardworking, and dynamic young neurosurgeons. And I can proudly say, as an African woman surgeon, we have numerous social barriers, but at an organization level within CAANS, women all have an equal opportunity to thrive in a supporting environment. My talk today, I'd just like to acknowledge the co-authors. Together, we came together just to discuss the role of young neurosurgeons in global surgery and how we play a role in being a unified voice for health equity. So the reason I said young neurosurgeons is I believe women and males have an equal role to play in global surgery, and as equals, we can advocate for health care equity. So what is global neurosurgery? It's a group of surgeons, obstetricians, or anesthetists who are dynamic and encompass three factors. They're involved in research, clinical practice, and they're also involved in advocacy. So the overall aim of this is to improve health outcomes and achieve health equity. So health equity means that ideally everyone should have a fair opportunity to attain their full health potential. This slide, Professor Lynn gave beautiful statistics earlier in her talk, so I'll just highlight the fact that for a while, surgical conditions have been living in the shadows of medical conditions and under the global public health umbrella. And in 2010, that changed because 32.9% of global deaths were attributed to surgical conditions. And one couldn't ignore that 33 million individuals undergo catastrophic expenditure to access surgical care. And as highlighted by previous speakers, we have a disparity within our surgeon workforce. To take it closer to neurosurgery already, previous speaker, yet again, Prof. Lynn highlighted this beautifully. But what we need to know is that there's a workforce disparity. And as she mentioned, it's greatest in Southeast Asia and Africa. And we also have a huge burden of disease within neurosurgery. And the top 5 conditions are highlighted here in the graph. So why is neurosurgery important? As young neurosurgeons, we can't ignore the fact that 5 million of our patients cannot access our care. So they have treatable neurosurgical conditions, but cannot access care. This is a beautiful diagram put together by Ronnie from Philippines, which highlights the barriers that neurosurgeons and patients have to go through to access our service, because we nestled within urban societies, because we require certain high-skilled facilities to perform what we do, and we tend to work in multidisciplinary teams. So our patients end up encountering numerous hurdles to present at our doorstep. So keeping this in mind, one can acknowledge that surgery as a whole can no longer be viewed as the neglected child of public health. So in 2015, the Lancet Commission came together looking at global surgery and setting up 2030 goals that work to ensure health equity. And there were 6 sets of indicators that they recommended to help improve access to our patients to safe, affordable surgery. And as a team of young neurosurgeons, in our paper, we echoed this, that how we can play a role, and there's a few examples of how we're playing a role today. So firstly is preparedness, ensuring that your workforce is sufficient, that you have access to timely surgery, and ideally we would want 80% of essential neurosurgical services and the diseases that affect our patients greatly, which are highlighted above. And also we need to increase our workforce. So as young neurosurgeons, this is Dr. Ulrich and a team of young neurosurgeons, both continentally and global, have a publication coming out in Frontiers that try to look at what are the challenges that residents face in training and practice. What are the barriers to our surgical workforce? And 58.9% highlighted that they have limited opportunities to organize education and activities. So as a team of young African neurosurgeons, we run monthly webinars. And what is nice to note is that 50% of our educational webinars have actually been moderated by women. And they've been in charge of running that facility and running an excellent program. And on the slide, I'd just really like to acknowledge the young women in neurosurgery on our continents that are playing a central role in education. The next step is how do we deliver care to our patients? And the only way to do that is to track our perioperative mortality, how many of our patients are surviving, and also tracking our surgical volume, which is a huge problem specifically within our continent in Africa. We can't quantify the number of patients we are treating. And in an attempt to also just bridge this gap, young neurosurgeons came together and started a research symposium, which involves a 6-block course, which is aimed at research capacity in order that we can quantify our burden disease specifically in Africa. And then on a global level, a team of young neurosurgeons are working together to explore what is the current global neurosurgical research climate with respect to research activity, output, and capacity. And on the next slide, highlighted in pink are the dynamic women that are involved in this team. And over the next few weeks, we hope to launch this project. Lastly, which is a global problem that affects both HIC and LMIC, is that a lot of our patients have to encounter impoverishing expenditure to access our service. People lose their homes, people change their livelihood to be treated by neurosurgeons. And the role that one could play is building bridges between us as neurosurgeons, public health practitioners, government, and policymakers. And a beautiful bridge of this is the Blue Journal, which is the Journal of Global Neurosurgery, editor-in-chief being Key Park and the co-editor Ignatius Assembly. We can use this as a conjugate to advocate for our patients, research on our population, and ensure that resources are allocated equally in the future. And my last slide is one thing we cannot ignore is that we live in a global community. We can no longer live in our silos. And I think this is a strength as young neurosurgeons that we hold quite dearly. And in Africa, there's a term called Ubuntu. We are who we are because of our community. So together, working together, let's make the world smaller and have a unified voice as neurosurgeons for health equity. Thank you so much.
Thank you very much. Thank you very much, Nqobile, for this excellent talk. Beautiful indeed. And really, we count on you to improve neurosurgery in Africa. And I know that we've reached already a certain level, but we count on this youth, which is growing and going up, and of course, all over the world as well, particularly in Africa. We want really our specialty to boom, and women have got a big role to play, and I'm actually writing a paper on that, and I will submit to a few of you to read and let me know what you think about it, and so that we understand the role of women in neurosurgery, because they have some aspects which is definitely superior to men. And this is due to the software they have in the brain, which we don't have, we men, So in any way, let's not talk too much about that. We'll have a lot of questions, of course, later on. Now we have the last speaker, João Paulo Farias from Portugal. Unfortunately, I don't have the details about where you work.
Sorry.
Maybe Najia will help me on that.
Yes, yes, he's apologized because he has in the same time the meeting of their board of the Portuguese Society of Neurosurgery. So he apologized for that, and he couldn't be with us today. So I think it was the last
speaker on this session,
Nqobile, so we can open the discussion.
Okay, good. The discussion is open. People can talk maybe and address the questions directly to the speakers.
Maybe there is some question on chat. Omar, you can.
Let me, please help me check those questions.
From Omar Hamoud Al Omar. There is it's I think it's for it's a question for Atul, Professor Atul. There is a relationship between the mind of brain and the role of donkey. Professor Atul, are you here?
Yes, I'm here. Nazia, yes. No, I couldn't understand the question properly, Nazia.
You want to? I will repeat it. There is relationship between the mind of brain and the role of donkey. Sorry, but it's Omar Hamoud. I don't know from where.
See you.
Okay, I think it's
I saw the question, but I didn't understand it, so I skipped it.
Yes. Yeah, you are right. You are right.
You must remember that the brain of a donkey.
Question. I think it's not complete question. We will skip it.
Yes,
as told Kazadi. So Kazadi, you can continue your moderation. Maybe just before, if there is somebody to have, I just want to congratulate and thanks all the speakers for this wonderful session and for this all this message that we had today from each speaker. And of course, I'm so sorry for Professor Atul, but I promise you that next time you will be the alone the speakers for on 1 hour. This is a promise.
Thank you, Nazia. Thank you.
Yeah, and
we were hypnotized by your talk, Professor Atul.
Thank you so much.
And Sarah, it's a really very interesting talk. We learn a lot with you and as the first association of the Women in Neurosurgery, WINS. And I love one sentence I always quote it. It's WINS is a neurosurgery win. It's very beautiful sentence. It's from, of course, WINS of USA. You know it, of course.
Yes, indeed.
And this is for me. It's true because it's according to my experience, women when women are in neurosurgery are really and truly work harder than male, at least in the beginning, to establish their position, especially in academic position. I mean, but not only academic, but on all the position as neurosurgeon. What do you think about that? Maybe Gail, Lynn, all the speakers to add, and Sarah, if you had. Are you agree with my thought or not?
Well, no, I mean, I think definitely, you know, the pioneers in this area as women, I think have definitely worked harder to get to the table than I have, and certainly even my generation worked harder than the current people who are coming down the pipes, but I think we all work hard. And I think the key is what Gail said in her talk, which is the need to have diversity in neurosurgery. And you know, gender is one form of diversity, but culture, religion, all of those things are so important. And I keep getting reminded of that every single day as I interact with patients. We all bring something different, and we all have our own strengths and weaknesses individually. But the more diverse we make our specialty, I think the stronger it will become and the brighter the individual that we attract to it.
Yeah. And for Lynn, I'm really very astonished by the statistic that you shown us. That's the number of neurosurgeons globally, and of course, women in neurosurgery. It's really very
True. There is really a lot of need for us to expand, especially in the low to middle income countries here in the Southeast Asia and also in the sub-Saharan Africa. So we really need to encourage more people, more women to go into neurosurgery. I myself have been active in recruiting, talking to students. I lecture in I am a faculty of the University of Medicine here, and I talk to them. Whoever wants to be interested in neurosurgery, come and talk to me. I would mentor you, and encourage. But of course, I would need to see the competency, because I only want the best for neurosurgery. Whether man, woman, I want the best for neurosurgery, because if we encourage the young generations to be the best, who would take care of us getting older? You the younger generations, we would consult them if we need. So who would want to get operated by someone less competent than you? Of course, we want somebody more competent than us, more knowledgeable than us to take care of us. So it's for the next generations.
Yeah. One thing that we are doing in our university, and you saw behind me, we are located now today. We organize this symposium in our university, and we diffuse all the webinar, the symposium and the webinars through the connection, all the students of our university. So it's one of thing to promote neurosurgery among young students in the medical school. And for Nqobile, it's congratulations for this wonderful talk, and I hope that everything is okay now in Cape Town, and this is I hope we wish you a better thing for this catastrophe. And I would like to congratulate you with Ignatius here and all the young neurosurgeons, African young neurosurgeon, to help Dr. Key Park to, of course, launched last week, last Saturday, the Global Neurosurgery journal. Is very, very interesting, important in this time to have one journal like this, because we know that global neurosurgery or global surgery is very important for needs, particularly for low and middle income country. As Lynn said, it's not only in sub-Saharan in Africa, in sub-Saharan Africa, but also in many others area in Asia, in maybe in Latin America, and or Europe and USA are more lucky than us. I think. So thank you for this wonderful talk, Nqobile.
Thank you so much, Prof. Najia. And it's a team effort amongst all the young neurosurgeons on our continent. And also thank you and to our mentors, because you saw that quote from Isaac Newton: we're only able to achieve because we're standing on your shoulders. So thank you for that. Okay.
And finally, we have with us Professor Hussam Husseini Kazadi. Your co-moderator is arriving.
Okay, thank you very much. I hope I was up to the standard. Anyway, I would like to congratulate and thank all the speakers. They were wonderful, excellent talks rather. And so I would now pass on this talk to the next session, session number 3, and I let you, Najia, to guide that, to make the transition.
Okay, thank you so much, Kazadi, for this excellent moderation, and keep time in keep the time. It's very important for us because we are, we are in Ramadan, and we have a little bit problem with the time we have to finish at 5:30. So we maybe Professor Hussam Husseini, he would just arrive. I will thank him to join the next session, and I will ask first Professor Khamnishi, our master, our honorary president, WFNS honorary president, who will moderate this session with Professor Souad Bakhti, our dear friend from Algeria. She is, as you know, the chairman of the WFS and WIN committee. And Hussam, you are here. You can give us some help if you want to, and we will see in the end of this session if you have some comments. Okay?
Actually, what?
So Professor Khamnishi and Souad, go ahead. You have the micro for the... Professor Khamnishi, you are in mute. Can you unmute yourself, please, Professor Khamnishi?
Yeah. Do you hear me now?
Yes, now it's...
Thank you. Thank you. Thank you very much, Najia, and
Yes,
thank you for all the organizers for this honor to share this session in this excellent symposium. I'm very happy to attend it, of course, and to see all these presentations which have shown us how we should, all of us, women and gentlemen, to be in favor and push the advocacy to encourage wins worldwide. And I think that when we see the work done today in this symposium by these two important WFNS committees, education and women in neurosurgery, which both of them are chaired by women, we can understand how it's important for the future. The leadership, the women leadership at all levels, but mainly at the level of the WFNS. So we hope that we will all together succeed to have more women in this high institution, and of course to encourage and increase the number of women in neurosurgery. Now we have the pleasure to share this session with my co-chairman, our lovely Professor Souad Bakhti, the chairman of the Women in Neurosurgery. So it's my pleasure to ask her to start this session and to introduce the first speaker. Please, Souad.
Thank you, Professor.
Ladies first.
Thank you. It's a great honor to co-chair with you this session. So we will begin by Professor Souhil Tliba, who is the head of Department of University Hospital of Blida, and also a member of Education Committee. And he will talk about the Day of Women Neurosurgeons. So, Professor Tliba, are you here, please?
Yeah, I'm here.
Okay.
Ladies, and I can start, Souad?
Yes.
Okay. Ladies and gentlemen,
yes, you
dear
yes,
colleagues,
yes.
and I'm honored, and it's an honor and privilege to be invited by Women in Neurosurgery committees. Despite the difficulties and the specificities of neurosurgery, women have shown great success and ability to cope with the various tasks of life and even to be at the top of the podium. Then, in nutshell, female leadership is a reality. Women neurosurgeons leadership is a reality too. Forbes magazine defined leadership as a process of social influence which maximize the effort of others toward the achievement of a goal. The characteristics of leadership are, leadership has nothing to do with seniority or one's position in hierarchy of company. Leadership has nothing to do with titles. Leadership has nothing to do with personal attributes. Leadership isn't management, and leader is different to manager. Et si l'homme de la situation se révélait être une femme? What if the best man of the job is a woman? What if the best person of the situation, in many cases, is a woman? Then the woman are value work-life balance. The women are empathetic. Women can make great listeners. They focus on teamwork, are good at multitasking, strong communicators. Women can dream big, very big. Women handle well crisis situation. Women can wear many hats. Women have high emotional intelligence. Women have
I think we have a problem now. Souhil.
Sorry.
Yes, you have problem of connection, I think.
I carry on?
Yeah, please.
I can carry on? Okay. Yes. I will share my, it's okay? My screen?
Now it's okay.
Not yet.
It's okay, okay. The best example of leadership, was born leadership, is the girl Greta Thunberg.
Your slide.
You need to share your screen. It's not yet.
Yes.
Okay, I will share again. Is it okay?
Yeah.
Is it okay?
Yes.
I carry on?
Yes,
okay.
Please.
In this diaporama, as you see, there are many leadership neurosurgeons women, like Isabelle Germano, like Souad Bakhti, Najia El Abbadi, and others. Women neurosurgeon, female neurosurgeon, has many challenges and responsibilities. Professional challenges as neurosurgeon, family challenges and responsibilities as mom, wife, daughter, and sister, and societal challenges as citizen. I would like to share with you a story, and I would like to tell you a story, to tell in a story for the story of a female neurosurgeon. I will.
Hello, I am Dr. Yahya Zubir Amina. I'm a neurosurgeon. I have a lot of challenges and responsibilities. A challenge at home as a mom and wife. A challenge in my job as a neurosurgeon. And challenge in the society as a citizen. But the common and the biggest challenge is to be a woman. Every morning, I wake up at 6 o'clock. I get ready my kids to go school. Bye-bye, bye-bye. I just arrived at work and we starting the conference.
En oncologie médicale, âgé de 42 ans. Je suis en Égypte pour une hydrocéphalie biventriculaire.
I'm doing my daily tour in the service. We are going to operate an hydrocephalus with endoscopic procedure. I am assisting a conference about neuroanatomy. After work, I go to the autism center to get my son back home. I spend my time running after him. I cook the dinner, then I help my kids in their homeworks. Salut.
Au revoir, mon Kabir. Au revoir, mon Kabir.
It's dinner time.
After dinner, I put the kids in their beds. Oui. Bonne nuit, Yassine. Bonne nuit. Dis bye-bye. Dis bye-bye. I give you a little glimpse of my day, hoping you enjoy it.
As you see, the daily of women neurosurgeon is very hard, and women neurosurgeon is multitasking. We conclude with a question: do we have to promote female leadership? The response is yes, but the woman can learn and teach the man many things. Do not lean in when you have nothing to lean in about. Know your own limitations. Motivate through transformation. Put your people ahead of yourself. Do not command. Emphasize. Focus on elevating others. Do not say you are humbled. Be humble. In the future, there will be no female leaders. There will just be leaders. Thank you.
Thank you, Souhil.
For your attention.
Thank you, Souhil, for this very beautiful talk.
Thank you for your attention.
Professor Khamlishi, I'll let you introduce the second speaker, please. We make the discussion at the end.
Yeah, thank you, Souad. The next speaker is Dr. Aneela Darbar. She's going to speak about a very interesting topic, challenges in life balance with two full-time professional jobs. I think she will give us the real balance also of this time of women in neurosurgery. Please go ahead. Dr. Aneela, she's here. Yes, you are sharing your slides. Please go on.
Can you hear me?
Yes, we are hearing you.
Okay, great. Thank you so much for inviting me, and I am really thankful to all the organizing committee, Dr. Najia, Dr. Souad Bakhti, and Dr. Isabelle Germano for bringing together this WFNS joint symposium and showcasing the work of all these fantastic neurosurgeons, their aspirations and their work life over here. So with that, I am going to start my talk. Sorry, I'm just unable to move my slide. What is happening here? So just a brief introduction from me. I graduated from Upstate University in New York, from Syracuse, New York, and I did 2 skull-based fellowship, one endoscopic in Australia and then a open skull-based in the US. And after that, I spent my early part of my career in St. Louis University as an assistant professor. And in my earlier career, you know, what I really wanted to progress and be a part of my career was academic neurosurgery. I came from an academic neurosurgery program. My earlier career was in academic neurosurgery, and that's what I wanted to pursue in my life. At that time, I decided to move back to my home country in Pakistan, and I joined the Aga Khan University Hospital in an academic position. And soon I became the program director of neurosurgery over there. What I did, which was my biggest passion, was to start the Women in Neurosurgery chapter in Pakistan, which I started in about 2015, mobilized a lot of female medical students, and so that they can choose neurosurgery as their own career, and bring more female neurosurgeons in Pakistan, because at the time when I came in 2013, there were very, very few. I served on different hospital committees, and therefore my entire life was dedicated towards going towards academic neurosurgery. However, in between my career, I had the opportunity and I got a job offer to be a medical director of a hospital. Of course, it was a great leadership position. I had never been in a leadership position like being a medical director of an entire hospital. I was definitely ecstatic, but I was confused because I had planned my life to be an academic neurosurgeon, you know, this was the time I was about to become an associate professor. I was a program director. My neurosurgery career was flourishing. And at that time, I offered to be in a medical director, not in the same hospital, which would be much easier, but actually in a brand new hospital in a city which was about 800 kilometers away from where I lived, in a city which was much conservative and not as cosmopolitan as Karachi, where I am. I sought advice from a lot of people, and people were saying that, you know, you are in the middle of your career, it's flourishing, and people take medical director's job when they are in their 60s. And you are in your mid 40s, what you should do is just build up your neurosurgery career at that time. I thought a lot, and at that time I decided that if I want to do something, then I think mid 40s is actually the right time to take up a new challenge. When you are old, then you do not have that kind of energy or that kind of enthusiasm to go into a completely uncharted territory, because it requires a lot of learning and to actually come out of your comfort zone and to do something that you have never done before. So that's at that point, I decided to take up this medical director's job. And I moved to this different city with a much larger vision that maybe I can become the CEO of a new hospital. And I said, this town was much different to the town that I had been before. So when I assumed my role as a medical director and a consultant neurosurgeon simultaneously, much to my chagrin, there were a lot of things that I just discovered. First, I discovered that the two jobs are 180-degree polar opposite to each other. As a neurosurgeon, you are a sole decision maker. You know, if there's a case whether it's an operating case or deciding for a case, you seek individual advices, you seek multiple tumor boards or different kind of boards, but you are the one who makes the decision. But when you become a medical director, you cannot decide alone at all. You have to bring all the stakeholders on the table. You have to bring everybody from top part of the management to the bottom part of the management, from the higher management, seek everybody's advice, seek everybody's approval, and only you can be able to make even the smallest decision at that time. And this, what I found was very challenging, because as a neurosurgeon, I was always used to of making a single decision. And here as a medical director's job, not only I have to set up the neurosurgery department in this new hospital, but I have to set up every single medical department of this new hospital. And suddenly I realized that this was a very challenging job that I have taken. And I decided to go full throttle and see whatever I can do, and I will do my best. The first thing I realized was punctuality. Punctuality as a neurosurgeon, we are always on time for our operative cases, but we usually dedicate our time according to our work, our clinics, our research work, our operating time. If we are operating till 2 a.m. in the morning, we usually decide to come late. But when you are in actually a management and an administrative position, this adventurous attitude of coming late is absolutely frowned upon. So you, no matter come rain or shine, you have to be in the hospital at 8 a.m. in the morning, complete your 12 hours of your management work, and then you can embark on any other thing. Like for me, it was neurosurgery at that time. And it doesn't matter that you have done a very complicated skull-based case and you have gone home at 3 a.m. in the morning, you have to be there on time. The next goal that I wanted to set was the standards. So I wanted to bring this hospital, which was a brand new hospital in a different hospital, to have international standards with international benchmarks. My goal was that I want to set up a hospital that has quality care, that is both employee as well as patient-centered, and actually practices ethical care work in that hospital. So first, the standard that I set was we applied for the regional and the statewide accreditation. The second, we decided to embark on an international benchmark, which is the JCIA, so that we have accountability, patient-focused and performance-driven work. And so in case, even if I leave the hospital later on, the international benchmarks that are set would help the future doctors to come to do the work in the best possible fashion. The third thing I learned being a medical director is to keep the communications open. And that is the best way of dealing with the management services. One-on-one meeting, which I called as Coffee with the MD, I invited every single doctor of the hospital, junior or consultant, every allied staff, including the physiotherapist, the speech therapist, each one of them to come and have a 15 to 20-minute meeting with me. And I scheduled them so that I should be able to know what their goals are, what their aspirations are, how do they want to succeed in their future career, and how the medical director's office can actually help them succeed in their future goals. The next thing I learned was big town hall meetings. If you are deciding on a big policy, a big decision making, reshuffling of the clinics, opening a new block for a completely new department, what you have to do is bring everybody together in the hospital, and that can be only done by presentations through big town hall meetings. For smaller communications, email updates all the time is absolutely necessary to keep all the stakeholders and share the information at all times. My next challenge was to foster the teamwork. So here I am with the challenge of making several different departments of medicine and of surgery in this new hospital. I had to make the whole committee, like when we go to a hospital and we are involved in a committee, we just take it for granted, which I had always taken for granted when I was involved in an operating team or ICU committee team. But when you have to set up the whole committee by yourself, you learn that if you do not foster teamwork, you actually cannot go forward. Because when you foster teamwork, only then you can have the proper patient care and performance. And then you also get compliance for the administrative activities, because to get the work done by people is also a completely new skill set that I had learned, because before I had to work with my own self or with my neurosurgery residents, but now I have to get the work done by a multitude of different departments, different facilities, and to get the work done, the only way is to develop, delegate the job, and make sure that a handover or re-handover and compliance is followed through. And this also leads to leadership skill. When you do that, you actually foster the leadership skills in different people. So when you make chairs of the committee, co-chairs of the committees, and then you let them lead the committee, and then you just overshadow them just to see that they are doing work, people actually develop good leadership skills by doing that. Time management become a huge issue. So to do 2 full 8-hour jobs by being the medical director, which requires a lot of your time efforts, as well as being a neurosurgeon, which also requires a lot of your time efforts. So when you have that, you can stretch your, of course, 12-hour day is not possible. Usually your hour stretches to 14 to 16 hours. Sometimes you have a disaster in the hospital that you have to manage as a medical director, or sometimes you have a complicated skull-based case that goes 3 a.m. in the morning. So your hours are never 12 or 16. They go just like beyond, whenever you finish. And when that happens, your life suffers. You are unable to give time to your family, your friends, even your children. You cannot do any kind of athletic activities, and certainly there is no me time for your own self. So working in a hospital in a very conservative part of the town, when I had come from the US to Pakistan, my biggest challenge at that time was being a female neurosurgeon and being taken seriously to make sure that people or the juniors or the others actually follow your orders and do what they want to do. When I was a program director, I had issues that people were reluctant in following orders. And in my years of a decade of work in Pakistan as a neurosurgeon, I had overcome that issue. And then the people had started looking at me as a women neurosurgeon and not just a woman. But when I came to this new hospital, I think this was the tip of the iceberg for me. But suddenly I realized not only I have to deal with neurosurgeon or neurosurgery residents, but I have to deal with many other different doctors from a very different kind of fields and many other allied professionals. And getting and having a woman boss is in a patriarchal society where gender roles are so predefined that women are the only job for women is household work or to raise children. It becomes a big task to get all your administrative work get done. So how did I manage my work-life balance? I have been in this role for almost last 1.5 years. And the lesson that I have learned that when you are in a management position, in a higher up management position, when you have to set up an entire hospital, it's better to be in an advisory role rather than an operational role. Because when you're in operation, when you're in advisory role, you can do that by making teams, by building committees, by enhancing work, delegating the jobs, and fostering camaraderie, and then leave the operational work to other people, be in the advisory role. So then you can also follow the passion of neurosurgery, which I have. I do not want to leave my neurosurgery at any point in time because it's my first love. But I have learned now to move out of the operations into an advisory role by doing all this work. And now I have much more time, which I can carve out the time for, if I want to do gymming or running or meet my family or even just me time and do meditation, I can carve out that time. So what I want to conclude in the end is that in the last 1.5 years, I have realized that both the job of a medical director and both the job of a neurosurgeon is something that require high performance and high consistency. And you can only do that if you actually delegate the work, make teams, make committees, and become much more of an advisory position rather than an operational position. Then you can balance both your life and both your jobs together. And one thing that I also want to advise to young females that leadership, of course, comes through academic positions as well, but this is also another way of attaining leadership. In the last 1.5 years, I have learned immense leadership skills, and my confidence level, which was what it was 1.5 years ago, is very different from what it is right now. Thank you so much.
Thank you. Thank you very much, Dr. Darbar, for your excellent presentation and for almost keeping in time, just 2 minutes more. But you have shown us in your experience how to keep balance not only between our professional responsibilities and home and personal needs, but also within in our professional, how to keep a balance between the job of management and of course the technical work of neurosurgeon. And maybe again, you have shown us another high quality of women when they are in leadership. Thank you very much.
Thank you.
Please, Professor Souad, the next speaker, introduce the next speaker.
Next speaker is our friend Ignatius Essene, who is the chair of the Young African Neurosurgeons Forum, very active, working hard with publications. And he will talk about Young African Neurosurgeon Forum and role of women. Essene, are you here?
I'm here, Prof. Thank you so much, Professor Souad. Well, thank you so much, Professor Souad. It's a great honor and pleasure for me to be here this evening to talk about the Young African Neurosurgeon and women leadership. And Africa is blessed to have two great ladies, women, and mothers who are matrons to the Young African Neurosurgeon Forum in the name of Professor Najia and Professor Souad. And we've been working with them for the past 3 years in the CAANS AC, and they were very supportive to push ahead the activities of the Young African Neurosurgeons Forum. I also want to seize this opportunity to thank Professor Korashi for his leadership and all the entire CAANS AC team. I want to thank Fahd, my very good friend, for organizing this very good meeting. And this was a picture I took Professor Souad about 10 years ago in Rabat. And I was having some mentorship lectures from Professor Kalangu, my mentor, and Professor Najia here. This Professor Zanon and Professor Gero. So, I'm from Cameroon, and you all know Cameroon is called Africa in miniature, which means that every other thing you find in Africa is located in Cameroon, from north to south, west to east, and Central Africa. I work in the northern part of Cameroon, which is covers 3 regions with a population of about 10 million. As a pioneer neurosurgeon in this area. 50 years after independence, they have never had a neurosurgeon. And so when I returned, I was sent there by the government to set up the first neurosurgical unit. And in the northwest part of Cameroon, which is my hometown, there's a university there. I saw the pioneer neurosurgeon there, trying to set up an academic neurosurgery center there in the northwest part of Cameroon. So this is my neurosurgical unit, which is about 18 months old. started building from scratch. Our team is putting a lot of effort to put everything in place. We've had X-rays, CT scan. We were just bought the CT arm. We have the endoscopic set. We try to get the endoscopic set for brain surgery. And this is a 20-bed unit, and the MRI center is under construction. And the center was recognized recently with the WFNS Foundation Gazette, published last month. We do a bit of surgery. We started doing some kind of complicated surgery at the moment. Before we used to just do degenerative diseases and hydrocephalus and trauma. Now we started doing some good surgeries. This one, most recent case, which I did last week, and the patient is doing well. So coming to Africa, Young African Neurosurgeons Forum and the role of women, we look at this issue in three plans. We look at, just give you briefly, the mission and the vision of the Young African Neurosurgeons Forum, talk about the organization in terms of anatomy and physiology, and then the role of women in this organization. So a Young African Neurosurgeon is a resident fellow or a consultant within 10 years at the end of his training. And this group or this forum aims to represent and promote the interests of young African neurosurgeons, be it within the continent or out of Africa. And Professor Franco Servadei usually say the future of African neurosurgery is in the hands of young neurosurgeons. So we have a very big role to play in the development of our continent. The Young African Neurosurgeon Forum is a turbocharged organization with a leadership approach, which is bottom top. We link to all the Young Neurosurgeon Forum, the different continents, and also to the WFNS Young Neurosurgeon Forum, with which we collaborate to do a lot of activities, where our membership is about more than 350, and we keep on growing on a daily basis. Our main activities are classified into three. We focus on patient care because Africa has a limited workforce in terms of neurosurgeons, so and the workload is very high. So we focus mostly on patient care. Then we do a bit of training, continuing education, and then promoting research, and of course get mentorship from our senior African neurosurgeons. Well, our activities since the creation of this forum can be divided into two eras: the conceptualization, which was the building of the foundation of the Young African Neurosurgeon Forum, and then the actualization divided into two eras: the pre-COVID era and the post-COVID era and the pay-COVID era. In Abuja in 2018, the Young African Neurosurgeon Forum was created. And then we had a series of meetings trying to bring everybody together. We organized a meeting in Kinshasa, which was hosted by our friend Jeff Talaja. In Antalya, each time we meet, we Africans come together to discuss things of our common interest. John Jambani was in Senegal on a meeting on hydrocephalus and spinal dysrhythmism. He discussed with other young neurosurgeons to see how we can move our continent forward. This was in Tangiers in 2019 on the invitation of Professor Niger. So we met with the Moroccans young neurosurgeons and we discussed how we can bring our continent together to move forward. Professor Fige was in Cape Town trying to mobilize the young neurosurgeons there. And there were Landry and Aisha in Cote d'Ivoire. They organized a cadaverica, which was actually the first in the sub-Saharan region, excluding, of course, South Africa. And this was in Cairo in last year during the pediatric neuro-oncology group organized by Professor Mohamed Bertegi, where we met with all the African neurosurgeons. We discussed cases in our social media forum. We share documents, articles, and give people information about what is happening across the world. But we realized that all this was not very organized. So we started asking ourselves, what kind of neurosurgeons do we want to have in the continent? Intuitively, we realized that the picture in the continent is that on the left, where we have a neurosurgeon who spends most of his time treating patients and having little or no time for education and training and research. So we came up with the concept of the academic neurosurgeon, which I published with my mentor, Professor Hussein, who just came in a few minutes ago, as somebody who does not only treat the patient, but is involved in education and training, research and practice of public health, which keep back added to this definition. So, but we found that in Africa, there are some obstacles and challenges to realize this because the African neurosurgeon faces a very high patient volume. So therefore, they have little time to carry out all the other activities in terms of education and training. But we try to encourage everyone to practice this. So therefore, we started looking at what are the challenges of the young African neurosurgeon? What are the barriers as outlined by my friend and colleague, Dr. Nqobile? This is because I always believe that for us to be able to make good decisions, be able to make better health policies, this has to be based by, this has to be guided by evidence. Neurosurgical policies should be guided by evidence, and neurosurgical decision making should be guided by, because in Africa we have limited resources, and therefore we need to scale our preferences so that we focus on the most essential things so as not to waste our resources. So our study showed that the needs are numerous, but the most pressing ones were lack of access to educational and research facilities, of course, fellowships and other things which I'm not going to outline today because of limitation in time. The paper was published recently in Frontiers in Neurosurgery. I will address one of the problems, which is that of research, because it is the most pressing issue, not only in Africa, but all LMICs. As you see from this graph, the paper published in 2010, only 0.3% of the publication came from Africa. You see, and 75% came from North America and Europe, and Africa has contributed only to 4% of the articles published in all the LMICs. So the problem is very crucial in our continent. So we needed to do something to change this. So we therefore started in 2018, we organized a research capacity building course in Kinshasa, sponsored by our friend again, Jeff. It was highly attended. We already planned to have other courses in Niamey, in Niger, in Cairo, and so on and so forth, but COVID came and everything changed. We also tried to liaise with a lot of journals. With a team of young scientists in Africa, we created the Pan-African Medical Journal. We've worked with Professor Ahmed Zodi in Cairo with the Egyptian Journal of Neurosurgery, which is supportive of young African neurosurgeons. We've gone to other journals to try to get special issues, focus on pathologies found within LMICs, like in Frontiers. And recently, under the leadership of Professor Kipak, the Journal of Global Neurosurgery was created, which is now like a panacea to solve the problem of providing a public space for researchers in LMIC to be able to publish their papers. One of the things we've underscored in the young African neurosurgeons is collaboration. There are very few papers, multi-center studies done within African countries. Africans collaborate with other countries out of the continent, but very few within. And this was one of the first papers, collaborative research involving 3 countries in Africa under the leadership of Kazazi Kalangu, looking at hydrocephalus. And during our last research course, we talked about a number of projects which we intend to carry in the continent. The first one is ongoing. The centers in the Lions Hospital in Addis Ababa, Cameroon, my department, and in Niger under Professor Sanusi. And with our friend John Jamban, who is the pioneer and the only neurosurgeon in Gambia, we are planning to do a lot of studies looking at sport disease, traumatic brain, and traumatic spine injury. We also want to look at other aspects. Of course, we support collaborative research out of the continent, but there are a number of criteria which need to be respected. I mean, we think that if we need to collaborate, the projects conducted within the continent should be owned by Africans. These projects should be aligned with our needs. There should be harmonization so that these studies can be put together to provide guidelines which are going to serve Africans. Data management should be by the collaborators, and they should need mutual accountability, not having a host out of the continent and with Africans acting like recruiters. Of course, I always tell young neurosurgeons that it is not impossible to do things from within the continent, like this paper which I published with Professor Hosseini, who supervised my PhD thesis in Cairo. I mean, we challenged certain concepts in research. I was then in Cairo, and we looked at the way the case study, the report study design was defined. It wasn't very appropriate. So we actually provide a new definition that is accepted in all biomedical journals, and you can see in the instruction to authors in the Journal of Neurosurgery. It is now an instruction to authors. So even from Africa, we're able to produce high quality research that can be accepted globally. With COVID, we have to change our approach. We have to move from physical activities to virtual activities. These are a number of things that we've been able to do since the advent of COVID. We've organized 10 courses, including 2 symposia, 2 on them on research and 8 on continuing education. So what is the role of the African woman? What is the role of the young African woman? You know, we always see South African proverb which says that if you educate a man, you are educating an individual. But if you educate a woman, you are educating the society, you are educating a generation. And this was underscored in a paper by my mentor, Professor Kazazi Kalangu, who stressed the challenges that used to be faced by African women, because before, the role of the African woman was in the kitchen. Not that the African man didn't respect or didn't believe in the abilities of the African woman. The African man believed that the outside world was dangerous and they wanted to protect their women, so they kept them at home. But this has changed today, and we see a lot of African women excelling, like Professor Najia and Professor Souhil, who are holding very key positions at the level of WFNS. So in the WFNS, in the Young African Neurosurgeon Forum, the female play a very big role. For example, you see, these are some of the founders, people who contributed so much in the building of the Young African Neurosurgeon Forum. When we started in Abuja, they were able to mobilize the continent and bring everybody together. Christine Sylvia from Quebec, Zarina from Tanzania, Nesrine from Algeria, Aisha from Cote d'Ivoire. They played a very key role right from the onset of this organization. And during our meetings, educational activities, women have played a very key role, as underscored by Nqobile a few minutes ago. So these are some of the women that have participated in our activities. In some of our research activities, women too have also been leading. I mean, it's a paper which we published explaining the needs and the barriers of young African neurosurgeons, and women participated very immensely in this publication. Recently, we developed a curriculum for research for the continent, and this is coordinated by a female from Cape Town, a neuroscientist, who is going to be the link between the neurosurgeons, the neurologists, and the neuropsychiatrists, because we believe we need to look at the neurosciences globally and not just focusing on the neurosurgeon. So women have a very big role to play in our forum. I exemplify this with my very close collaborator with whom we've been working so hard to do a lot of things. Nqobile is an academic neurosurgeon. She's the example of what I call an ideal African neurosurgeon. She's a lecturer of neurosurgery in Cape Town, African leading university. She treats patients. She's a pediatric neurosurgeon, and she operates on complicated pediatric cases. She's involved in education and training. Here we were in Kinshasa during the research course which we organized during our webinars. She's a researcher. She's published high quality research, what we call bench research, not the kind of research that you see very often where people collect retrospective data from files and publish. We're talking about fine research, bench research. And she also has a role to play in global neurosurgery, the recent paper which she published in the global, which she led in the global journal of global neurosurgery. So this is the model which we want to have with the young neurosurgeon. Some young African neurosurgeon being one who treats patients, one who is involved in education and training, whether you are in a university or not, one who conducts research, and one who is involved in public health. This is what we want for every young African neurosurgeon.
And yet,
of course.
And yet, please, will you conclude? Because
yeah, I'm concluding. Yeah, I'm concluding already. Yeah, I'm concluding. Thank you so much, Professor Souad. Before I just want to acknowledge the people, I mean, the giants on whose shoulders I've stood. We have Professor Hussein, who's here, Professor Kazadi Kalangu, Professor Majid Seni, who sponsored my training while I was in Cairo, Professor Deschamps Benoit, Professor Davis, with whom I spent so much time in the United States, and Professor Kipak, which we came up with the journal, which is going to, as I said before, it's going to be a panacea for publication. You can follow us on social media. These are our links. And thank you so much, and Ramadan Karim to everyone. Thank you so much.
Thank you, Ignatius. You have shown us that publications are more and more in African continent, and I encourage you and the young to continue like this. Professor Khamnishi, would you introduce the next speaker, please?
Sorry, do you hear me?
Professor Khamnishi, could you unmute you, please?
Yeah, I'm sorry. Do you hear me now?
Yeah.
Yes.
Yeah. The next speaker is Dr. Teresa Somma. She's going to speak on the woman leadership in neurosurgery, aiming the peak. Dr. Teresa, she's a member of WFNS Women in Neurosurgery Committee. Please, Dr. Somma. Sorry.
Do you see my slides?
Yes.
Okay.
Yes.
Good evening to everybody. I'm very proud to be with you this evening. I would like to thank the director and the prestigious faculty of this symposium. So, sorry. Okay. Why is important to address the topic of women in neurosurgery? Probably women are different from men, or women and men play a different role in neurosurgery, or neurosurgery need women. Several authors examined the difference between men and women in brain and behavior. So they demonstrated that the female brain presents more synapses but fewer neurons than male brain. And the left cerebellar hemisphere is more developed than the right one in the female brain. Instead of right cerebral hemisphere is more developed than the left one in the male brain. These neurofunctional differences imply important consequences. On one hand, women are more flexible and accurate in facing a problem. Women are more sensitive and emotionally labile, but on the other hand, women are less readiness in managing a dangerous situation than men. Furthermore, women characterized by marked neuroplasticity present a particular multitasking ability, and this has been known since ancient time, when Ovid called Minerva a divinity of 1,000 works. But these gender features influence the way men and women behave at workplace and then in neurosurgery. It's true that women feel an imposter syndrome, that is a persistent feeling of impropriety. Women point out their flaws, their fevers, understating themselves. But at the same time, women show more conscious care for detail, working harder than men. This incessant and continuous efforts allow women to develop capacities better than men. So they can become leaders that emphasize more teamwork, mentors that do more research, and surgeons that interact better with the patient. In this scenario, it's important to analyze the condition of women in neurosurgery. In other words, does neurosurgery really need women? According to the recent literature, women represent not only peaks, but also an important element for care of a patient, for research, and so for the future of our discipline. But which is the condition of women in Italy? We can see that in the last 2 years, the number of female residents is increased, but is not change the situation of the senior position. We have just 5 chiefs of division with no full professor. But which are the problem hide behind this number? For sure, young women feel a tension between women can have it all movement and a realistic view of themselves as a mother, partner, employer, or leader. The identify obstacles, including the long working hour, length of training, but above all, the absence of a critical mass of female neurosurgeons in academic medicine and in practical neurosurgery. Furthermore, the way of working in Italy is not woman-friendly. There is much discrimination that minimizes the important contribution of women for our country. This led to a glass ceiling phenomenon that is an active barrier that slows down the promotion of the women. So the women that do progression in a male predominant area in a glass house represent such a rarity. At time, the concept of the women in neurosurgery remain a prestige and prejudice. But in this scenario, which is my perspective, which is a perspective of a young neurosurgeon, I think that it's important to focus our attention on our drive. That should be based on great passion, a strong motivation, a human self-sacrifice. All these things should be managed by a strict discipline, followed by education and study. But many times, all these things are not enough, and it's important, the lucky, and it's important to see the light of a woman who made a quantum jump. They teach me that the cooperation is the key for going far. by discussion, by cooperation, multidisciplinary cooperation. And in this scenario, we make attention to the delicate condition of a female patient in premenopausal period, in pregnancy, and in the era of COVID-19. Probably thanks to all this together, I was the first young elected member of Italian Society of Neurosurgery. And this was for me a great opportunity to link with other Italian society, oncologists, spinal academy, and with the international society like WINS Commit. This society is populated by great women that show me that the key of success is a result of strong-mindedness, unpretentiousness, courage, conscience, energy, self-sacrifice, and smile. Thank you for your attention.
Thank you very much, Dr. Somma, for this excellent presentation and this comparison you started between men and women in our professional activity, and starting from the scientific aspect, our brains, how they are made, and then how we behave. I think, and then concluding to the obligation to be together and to be in multidisciplinary team, even if we want to progress. Very good presentation. Thank you.
Thank you. Thank you.
My dear Souad, please, the next speaker and the last one, I think, not the least.
So the last one, but not the least, because it is Claire Karekezi. You know her very well. She was with you, and Claire is a woman who works a lot with women in neurosurgery in the WIN committee, and currently she's the chair of the WIN CAANS. So Claire, please, you can begin.
Thank you, Professor Souad. Thanks everyone for having me. Thanks, Professor Najia and Professor Germano for organizing such a wonderful webinar. And it's an honor for me being here. So I know I have a mission to be on time, but I will keep my given time on time. So are you able to see my slides?
Yes, we are seeing.
Yeah.
You can begin, Claire.
Perfect. So I'll begin. I'll be talking about the African women in neurosurgery and the progress we have made over the last years. Sorry. So I will start a little bit globally and broad. We know that Africa population is about 1.2 billion, and we have few neurosurgeons compared to the whole population. Actually, we count around 1,750. These are approximate numbers. Shared numbers can be found at the WFNS site on the workforce map. Amazing job done by Kipak and his team. And you will see that most of these African neurosurgeons, actually, most of them are located in North Africa, with the Maghreb representing more than 100 and 250. And the rest of the Sub-Saharan Africa is still, well, numbers have increased, but it's still very not well represented. Even if we count about 512 neurosurgeons, you will see that 238 are all located in the Republic of South Africa. So yes, we still need to increase the numbers in the Sub-Saharan Africa. So this is another paper that was published by Kipak and team, and some detailed numbers are given there. So from there, we know that some countries do not have not even a single neurosurgeon, male or female, and that a majority of countries still have very few neurosurgeons. If we take Nigeria, for instance, they still have 85 neurosurgeons for 206 million people. This is the rate of neurosurgeon is still small compared to the whole population. DRC, only 11 neurosurgeons for 89 million people. Uganda, 11 neurosurgeons for 41 million people. So some challenges have been put in reason, like socioeconomic conditions, and these for a long time made neurosurgeons, for instance, who train abroad to stay there instead of coming back to Africa. But things have changed over time. So we had, you know, I'm amazed to have Professor El Kamlishi with us here, who started the WFNS Robot Training Center in 2002. He trained several African neurosurgeons from several African countries, including myself, and I'm proud to be one of his mentees. And we have the project Africa 100, initiated by Professor Sami in 2012, that also contributed to training more African neurosurgeons. And then actually now we count more than 21 African countries with at least a neurosurgical training. So you see that things evolved over time. So I would like to acknowledge this first survey done by Professor Yoko Kato in 212. He counted all female neurosurgeons worldwide. So look at Africa. That time, Africa counted about 94 female neurosurgeons. But look at the numbers. Numbers are striking. Algeria counted 61, and Morocco counted about 13. So these are 74. So almost 80, more than 80% were located in between Algeria and Morocco. And you will see that less than 20 were located in countries of Sub-Saharan Africa. I will also not stop acknowledging effort of Professor Najia El Abbadi. And when she took the WFNS WIN chair, when she started her mandate in 2014, that's when we actually started looking back. So where are we? How many are we? We really did not know. And this is one of the first meetings that happened in 2014 in Rabat. And that time I was still a resident, and I was given a task to go and look at Professor Yoko Kato survey and ask other neurosurgeons and try to count again. So we tried to count in 2014. We found about 150, and still Algeria had more than 75 certified women in neurosurgery. So you will be surprised, but in 2014, this can be found at our WFNS WIN website. I started drafting this paper that became a landmark paper that we just published in March this year. And I was, you know, I didn't know how to put it together, but I started writing about the history of African women in neurosurgery. So then we started having more WIN sessions at various conferences. I will not talk about all the conferences, but the main ones, the conference that happened at Cape Town in 2016, you can see all these African women neurosurgeons. They started coming together, presenting the work they do, talking about their experiences. And the last one happened in Abuja during the CAANS in 2018. So then from there, we started coming together as a group, and we created this WhatsApp group from 2019. And this WhatsApp group actually have about 128 members. And from this WhatsApp group, we started not only sharing papers, discussing and talking, but we started having a small survey between ourselves and asking who is the pioneer, how many women are in each country. And then we came up with this landmark paper that just published in Neurosurgery Focus, March 2021. I congratulate all my co-authors and the senior authors who are, again, Professor Souad, Bakhti, and Professor Najia El Abbadi. So we found out, these are numbers as of November 2020. We found out that we had about 243 female neurosurgeons on the African continent, not counting female residents, and that about 187 were all located in North Africa. And you will see that the top leading countries with the highest number of female neurosurgeons were Algeria with 135, Morocco came second with 25, and the Republic of South Africa with 18 female neurosurgeons. So we go in this paper as we move forward. But I would like to say that we just lost Dr. Mame Salimata Dieng, who is the first wing from Senegal. Maybe I would like to ask a few seconds to remember her. She passed away in 2021, February. So yes, so as I was talking about this landmark paper we just published, going through regions, we found out that Northern Africa had the highest number, followed by Southern Africa, of course, as expected. And then it wasn't discouraging because we found that numbers were increasing actually in Sub-Saharan Africa. Eastern Africa counting 15, Western Africa counting 14, and Central Africa about 80 female neurosurgeons. So we go country by country, counting everyone, counting full professors, associate professors, and we came with a total of 243, now 242, with Mame passing away. May God receive her soul. And
Claire, your connection, please.
Are you able to hear me?
Souad, I think we hear you. We hear you, Claire. I think Souad, you have made you have the problem with the connection. You can continue, please?
So I can continue. Thanks. So
okay,
yeah.
Okay. No, okay. Now I'm hearing.
Okay, so
now it's good.
Thank you. So we have 242, not counting Mame Salimata, and I will go next. So some numbers were striking though. Look at Egypt, 3 women neurosurgeons with more than 500 male neurosurgeons. Nigeria still, 5 women neurosurgeons with more than 80 male neurosurgeons. And we were incredibly proud of Algeria with 135 among 273 men neurosurgeons. So I will talk about some of these pioneers. So we think that the first woman neurosurgeon on the African continent is probably Faisal Alam, who is from Algeria, and she became a female neurosurgeon in 1977. And then I would like to acknowledge all these names, starting from Professor El Abbadi, who became the first African full professor, and then Professor Souad Bakhti, who also became one of the very first few full professors. We see Dr. Nozibo Mare from Zimbabwe, I think, if I'm not mistaken, who became one of the few female to hold a subspecialty. Jamila Kafufi, she's from, though she's from Egypt, she became the first female neurosurgeon to practice in Egypt. Then Minette became the first female neurosurgeon in the Republic of South Africa. Then all these names, so it's not about me, it's not about anyone else. We are all became pioneers. All these names, they became respective pioneers in their respective countries. These are some faces: Professor Najia El Abbadi, this Professor Sladen with Shelley Timmons, were the neurons at the WNS. So we see Susan and Sylvia became the first win in Kenya, Dr. Minette, Dr. Salmata, Dr. Juliet from Uganda, Jamila from Egypt, Koteka, who became the first Black to graduate from the University of Pretoria. That was a milestone. Sarah from DRC, we have Ketia and Salimat from Nigeria, and Diawara from Guinea-Conakry. So in terms of leadership, where are we? Again, Professor Najia and Professor Souad Bakhti, they set the bar very high. So they became the first two women to become president of societies, respectively in 2014 and 2015. And you'll be surprised that this happened 31 years after the creation of their societies. It's not discouraging for us. We know we have to still work hard, but they made it. So they also became among the first female head of departments of their respective department of neurosurgery. And I would like to acknowledge Professor Najia El Abbadi, who is also the WFNS assistant treasurer, and she has been an incredible inspiration for all of us. So Souad leads the WFNS WIN committee, and you will see that we have at least 4 or 5 females from Africa who sit on the committee. So continuing with leadership, we have Amuna, who is the secretary at the Moroccan Society of Neurosurgery, Nabila and Nqobile and Beverly, myself, working at the CAANS. And this our CAANS, our CAANS Women Neurosurgery board, and we are really working hard to advancing things. So I will talk a little bit about academia. I'll finish soon. So we counted 8 full professors, and you can see that they represent 3% of all African women neurosurgeons. So numbers are still very low, and they're all located in North Africa. 12 associate professors, almost 5%. Again, 8 out of 12 located in North Africa. And I would like to acknowledge Professor Broadet from Ivory Coast, Professor Magege from Senegal, and newly associate professor Derkaoui, Maguette Mbaye and Aminata Kelani, and Beverly, who just became an assistant professor at Aga Khan University in Kenya. So where are we headed? Even though we see that numbers are increasing, Algeria still set the bar very high. We are looking to keep promoting a supportive environment for all of us, creating different opportunities, and keep inspiring female students and young residents to keep on track. And we want to keep lobbying international departments, even local departments, to increase learning skills for every African women neurosurgeon. We want to increase mentorship programs. That's what happens. I cannot take enough. Yes, I'm almost concluding. Professor Bakhti brought it. So Senegal also setting a bar very high. And we know that education is changing in Africa. And so there is hope. Numbers are changing. Things are improving with time. And this is not, these are not my notes, but these are credits from Professor Souad Bakhti. So our duty is to fight for education of female. And we do not have to feel guilty. We have to trust ourselves. We do not have to be super women. We just have to be ourselves. And African female neurosurgeon is running. So I will not take enough everyone. I thank all these incredible women and all these mentors who let me to become a neurosurgeon. And I try to
advisors, speakers, moderator.
So yeah, I think that was it for my talk. And I'm keen to take any question, and I'm looking forward to the discussion. Thank you.
Yeah. Souad? Professor Bakhti?
Professor Khamlishi, she had some problem with her connection.
Okay. Okay. Thank you, Claire, for your presentation and for this precise information about the women in neurosurgery in our continent. This is very important to know. Of course, the reduced number, but it's promising, it's increasing. And it's very important to have all these informations for different countries in Africa. Now, Souad, she cannot, she has no communication, I think, with us. We are, I think, quite late. So,
Professor Khamlishi, I'm here.
Oh, okay.
It's good now.
So please, Souad, go on. If maybe we have not so much time for discussion, but
yes.
we can have maybe 1 or 2 questions, or if you have a comment, Souad.
Yes, I think that, thank you for, first of all, thank you for all the speakers. Very interesting and superb talking, and you have keep on time, which is very important. And I just have to say that Claire said that we have to believe in our dream, of course, but we have to stop with this feeling of guilty regarding our caregivers, because of course we are caregivers, but this is not a fatality. So particularly for our countries of North Africa, because we have also Mediterranean traditions. So I think that time is for leadership for everybody who is at his place. I think that we are complementary. We are not here to say men, no, or only women. We have Gail talk about diversity, and this is the real conclusion. We need everybody in neurosurgery. And if it is time to have leadership in many places by women, it is time. If we don't be qualified, we are not qualified, but we have to be judged as men. This is what I have to say as a WIN chair.
Have you finished, Souad?
Professor Khamlishi?
Yes, thank you. You have finished? Thank you. Thank you very much, Professor Bakhti. You have, I think, said everything about this session. And I would like my tour as co-chairman to thank all the speakers of the sessions, and to say to all the speakers that, I think that they have convinced all of us that we have to work and to encourage together ladies and gentlemen to rise the number of women in neurosurgery, and to encourage their leadership, and of course to start from the young doctors and the young women resident who are in training. I would like to say that in this center, the WFNS Rabat Training Center, which was already mentioned many times, we did our best with the federation to take the candidate, the women candidate, when they have this candidacy. And it's, I would like to say, I see now that our president, Professor Servadei, is here. I would like to see that all of us, I think, with the federation are proud to have seen a quite good number, at least more than 10 female neurosurgeons graduated from this center, and among them some are already attending this symposium. And in the future, I am sure that our president and others and all the leadership of the federation, we will increase the number as soon as we have the possibility in candidate. But in addition, I think what we have heard in these presentations that we need more than the increase in the number. And maybe we can increase the number more if we increase the leadership. So this is what was said in all these presentations. So thank you very much for all what you have said. And now I give the word and the podium to Najia, and I think to the conclusion and keynotes or key conclusion of this symposium. Najia.
Okay. Thank you, Professor Khamlichi. Thank you, Souad, for this excellent moderation, and thank you all the speakers for this superb talks. And welcome, Professor Servadei, with us. Thank you so much. I know that you are very, very. Can you unmute yourself, please, Franco? Franco, unmute yourself. Thank you very much to accept our invitation, and I know how it's difficult for you to attend many webinars, many symposium, and I know that the time zone is different now from Morocco, 2 hours, and you have some commitment, and despite all that, you join us and in the final remarks. If you allowed me, I will just go through 5 minutes to summarize all this symposium, and I will give the floor to Professor Franco Servadei to give us some final remarks. Maybe Moody also, if you want, as the president of CAANS before Professor Servadei. So I will share my screen with you. Where is it? Okay. So it's
not
really
yet.
I'm sharing. Sorry. Okay. So we had a very, very nice and wonderful talks today. We have, of course, joint symposium with the two committee. The first one is the committee and education committee with the Professor Isabelle from New York, and the second one with the Professor Souad Bakhti, the chairman of the WFNS WIN committee. I would like to thank them very much for this disponibility and for accepting to organize with me this symposium. So I will go over some what happened. Okay. So we have the first speaker, one of the leaders in USA. It's Aruna Ganju from United States of America. She's speaking about mentorship versus sponsorship, and she gave us some advices and some information very important. And you see here in this slide, one of this slide, that in the beginning we have more than 50% medical student, and only less than 20% of the applicants in medical school go to the neurosurgery, and finally only 8 and 6% are practicing neurosurgery or certified practice in neurosurgery in USA. So it's even if in developed country the number of the women in neurosurgery is still low, and if you see in this slide here that she's shown us, it's the number, it's increasing, but really very, very slowly. And she gave us some advices what the solution to improve this number of women in this specialty. And the next speaker was Halima Tabani. We had the chance to have with us a young neurosurgeon from Pakistan. She is a fellowship currently in USA with Professor Isabelle Germano in Mount Sinai in New York, and she spoke about her journey and what was missing. The female, especially in Pakistan, the female mentors, the role models, awareness about available resources and guidance regarding work-life balance and overcoming cultural barriers. The next one was one of the greatest and greatest neurosurgeon from Australia is Kate Drummond. You know him very well, and she gave us many information about the neurosurgery in this area in Australia and in Asia also, and she gave us also one of the pioneer of neurosurgeon in Asia from End, Professor Tanjavur Santa Krishna, and also here you see our regrettable colleagues from Thailand. She passed away this year, a few months ago, because this pandemic, COVID-19. So God bless her. Our next speaker was our friend from Turkey, Nurperi Gazioglu, and she is very astonished neurosurgeon, because she is one of the biggest. She had a biggest series of endoscopy surgery in the world, but she's still very, very humble. And even though Turkey is developed countries, but the first academic woman, she was the first one, only became full professor in 2008. Nelci Zanon, our star, as usual in the Women in Neurosurgery, she did a lot for this community. She organized many webinars. She is the chairman of the pediatric chapter in the WFNS, and also she created one group of WhatsApp of women in neurosurgery who can exchange many information and many books also. And she gave us, she spoke about all the leaders in the WFNS in different committees. We have also another star today, Professor Atul Goel from India. He gave us one philosophical talk, but unfortunately we can't hear all his talk, because for giving us the main of his talk, he needs more time. So I hope that we can hear him in the future and give him more time to give us more advice and more wise advice. Thank you, Professor Goel. And our friends from USA, Sarah Woodward, she's now she's the president chairman elect of the WINS, Women in Neurosurgery in USA, and she talked about barriers for women to transition. She gave us some promoting how to promote yourself as a woman in neurosurgery, and of course becoming a leader strategy for transition into the new roles. She gave a really fantastic talk. Lynn Lushina from Philippines, she was also amazing, and I will to congratulate her for the new publication that she has shown us, very interesting. And unfortunately, we know that they are striving with the same thing that in Africa, in most countries from Africa, it means the number, the lower number of neurosurgeons globally, and the women neurosurgeon specifically in this area, and she give us these numbers. It's really it's really a very lower number of neurosurgeon in this area, and we need to promote neurosurgery in all these low and middle income countries. Another speaker from Japan who give us a more scientific talk. It's really very interesting. It's about how the hybrid neurosurgery. Oh, what happened? Hybrid neurosurgery. What happened? Okay. Sorry, because continue. Okay. He treat one of the most topic is the vascular and microsurgery for aneurysms, and he give us some advices about the new devices in a treatment of aneurysms, and also hybrid neurosurgeon can treat almost all vascular malformations safely, including complex ones. And women neurosurgeons are always he said that are always come to join this his team. And this hybrid neurosurgery for several diseases is it's very promising in the future. We need time, I think, to prove is that in the future is it efficient as in terms of occlusion of the aneurysm such as clipping. It means microsurgery. So Gail Russo, our phenomenal Gail Russo, give us a nice talk about the progress of women in neurosurgery, and she give us a recent publications about this, and she speaks about one of the topic which was currently very common. It's the diversity and gender in neurosurgery. And she gave us many informative statistics. Thanks for this wonderful and this amazing work that you are doing, Gail. Thank you. And we had also from Africa, from our young neurosurgeon from Africa, Nqobile Thango from South Africa. She spoke about the role of the young neurosurgeon in global surgery, and you know that the last week and on Saturday, unfortunately, most of us didn't attend this webinar, but this webinar is they launched the Journal of Global Neurosurgery with our friend Key Park. So congratulations to all the team of global neurosurgery of this committee to this huge and tremendous job that they are doing for global neurosurgery. And the creation and the launch of this journal is one of the proof that this job that they are doing. And we have also our friend from Algeria who are sharing with us how women can spend one day, and I think he shown us one of his residents, the Day of Women Neurosurgery between challenge and the responsibilities, and we saw how these women deal with his profession and his life and at home. Our Aneela Darbar from Pakistan, our great friend, she's now one of the newest in Pakistan, and she is doing and leading with two jobs, and she talking about challenges and work-life balance with the two full-time professional job, because she's a neurosurgeon, but she's also director of one institute in Pakistan. Finally, I think it's not the last one, but we had with us also our star of young African neurosurgeons, Dr. Ignatius Essene from the Cameroon. You know him very well because he is very, very active in many media, WhatsApp, Facebook, and others type of media, and he's actually taken charge many projects in Africa, especially with the young people and research in publications and many things. Thank you, Ignatius, for your excellent job. Teresa Somma from Italy. I love your talk. It's the second time that I hear it, and I find it very funny, very nice, and it's really one of the wonderful talk that I heard in my life about women. And I love also how you compare the brain of the man to the brain of the woman. Thank you, Teresa, to join us, and always say yes when we contact you. The last one, but not least, is our friends, our mentee, Dr. Claire Karekezi, who is trained in our WFNS Rubber Reference Center, and then she had 2 fellowships. And our duty in our center, Rubber Reference Center, and as women or leaders in Africa, is not only to have a cooperation, South-South cooperation, but a South-North cooperation. We are today with many centers of neurosurgery able to of course train our colleagues from sub-Saharan African, but we need also some fellowship in Europe, in USA, in developed country, to help us to achieve the complete training of our colleague from Africa, from Asia, as Lynn said, the difficulty that are facing in the low and middle income countries. So thank you so much for all the speakers, for all the organizers, for the 2 committee, WFNS committee for organizing this excellent symposium, for the excellent moderator, the attendees, and of course of my deep thanks to Professor Qureshi to be with us as a president of CAANS, and Professor Franco Servadei as a president of WFNS. Thank you to join us, and I'm sorry if I will be a little bit longer, but you have the floor, Professor Franco Servadei, or maybe Moody, you want to give some word before Professor Servadei, as you want.
Just like to reiterate what you have said. but with your permission, may I ask Professor Armando Basso to say a few words, because without his support for African neurosurgery, I'm sure that we would not have achieved what we have managed to achieve. And I'm sure Professor Kamlishi will agree that without the support of Professor Armando Basso, we would not see the beautiful days that we are seeing now, and the immaculate presentations that have been made by women from all corners of the globe, which have gathered on a CAANS or a African webinar today. So with your permission, may I ask Professor Armando Basso just to say a few words before Professor Franco Servadei gives the closing remarks, if that's all right with you, Najia.
Of course, of course.
Sorry, thank you.
Professor Moody, because I'm so sorry. I didn't see you in this webinar. So of course you are welcome.
Yeah, me too. I didn't see Armando.
Sorry.
Hello, Armando. It's great to see you. No, it was a great pleasure to be and participate in the extraordinary symposium. So what I have to say is I congratulate all the organizers, and especially Najia El Abbadi, because really it's a tremendous success. And I had been always a strong supporter of the WIN group and society, because the participation of women, no way, this is mandatory, and it has been mandatory, and I hope in the future we will still better and better with the stronger responsibilities in all the organizations. So thank you for let me say something, and really I congratulate again all the organizers, and especially Najia. So thank you. I enjoy enormously this symposium. Thank you.
Thank you so much, Armando. I'm so sorry. I didn't see you, but you know that you are Moroccan as us, and our great friend of Morocco. Thank you. So Professor Franco Servadei, maybe you give us the closing remarks and close this.
Najia and all my friend, Professor Kamlishi, Professor Qureshi, Isabelle, Souad, Bakhti, all my friends, I've been with you for almost 6 years as president-elect, and as president, we have been together during this terrible 1.5 year, 1 year more about pandemic. We are still here in the middle of the third wave, fighting between vaccinations and patients and whatever it is, but we survived. Neurosurgery survived, was able to adapt to difficult situation. The women had an important role in this survival of the neurosurgical units. As you see, as we have seen, they paid also a price to the pandemic, and we are deeply sorry for many colleagues. At the moment, more than 110 neurosurgeons all over the world lost their life because of COVID. So it's a large number. We are a small community, and the most sad thing is in the last 2 weeks, we received the communication of people dying by the societies, and 5 of them were below the age of 35. So we're all in training or young neurosurgeons, so it's terrible. The price we pay, all of us, to this virus is terrible. But apart from this sad story, when I became president of the World Federation and I had to nominate the responsible for the committees, I was the most important committee is educational committee, and I insisted to have a woman there, and we picked up Isabelle Germano, and it was a good choice. She was very active and proactive, inclusive,
everyone was included in the work she did in the World Federation, the same that Nelci did for pediatric neurosurgery, Souad did for the WIN, and Najia did as officer of the World Federation. By the way, Armando is here, is our memory, but I don't remember that a woman was running for the presidency of the World Federation. I don't think it never happened before. So the only fact that, Najia, you are running for, we don't know if you will be the president or not, the elections are there, but the only fact that you can run and you have the reputation and credibility for the whole continent and from the Society of Neurosurgeons in the world is important by itself. We will see the result, but by itself is the first time that a woman is running. And I have seen your presentation, Najia, about the various positions, but one thing is important. Now we talk about global neurosurgery, and there has been a recent paper published by the group of Key Park and others concerning the number of most cited papers in global neurosurgery. And before this meeting, I have looked at the names, and 1/3 of the name, 1 in 3, is a woman, a neurosurgeon. So the contribution of women to the new movements towards global neurosurgery is important. And more important, because we talk in general, I give you a very simple example of how important are women in neurosurgery, young women in neurosurgery. Our university made an exchange with the University of Surabaya in Indonesia, and we start exchanging residents between the two universities. You can imagine the cultural difference between Milano and Surabaya, which is completely. But when we had to send there our first resident, I insisted to be Maria Pia, 150 resident with us, who is a woman, and she had to spend about 4 months to work and produce papers in a country where she has never been before, with a different culture, religion. And then after 3 months she was there, I went there to give a speech, and in a conference she was there. And they had a group of women working in neurosurgery, Indonesia, plus Maria Pia, very strong. They were all happy. She was very well reputed by everyone. And she wrote a fantastic paper, which was published in Focus together with our Indonesian colleagues. So the women are strong. The women are important. And in many countries in Europe, in my country last year, we had 50% of new residents are women, and we are happy with this. We respect them for what they do and for what they are. And as Souad say, we judge them as neurosurgeons independently from women, men. They are neurosurgeons, and they are very well dedicated. And what I have learned in my life is that we don't need to consider them in any particular way. They will show themselves up anyway. They will show how they can work with, how they are important in collaboration, how can they establish roots and discussion with the others. So I think the future of neurosurgery is more and more, and the future of surgery in general, not only of neurosurgery, is more and more women. And the future of our society, of our neurosurgical society, is having more and more respect for our women colleagues. So I think I have done what I could to promote the role of women in neurosurgery, as my predecessors have already done. And I think we are moving to a new era where more and more, I mean, the data from US, remember, are not the data we have in Europe. In US, there has been an increase, and then there is a plateau. In Europe, is an increase, stop, it's moving like this. It's completely different. I told you, my country, is 50%. In Portugal is even more. So we have an increase and increase and increase, and neurosurgery is not surely suffering from this. They are working very well. We are happy with this. So I appreciate a lot, Najia, for what you have organized today, and all the best and all the support of our World Federation, even when there will be my successor. I think the line where we will move and respect and responsibility to our colleagues. Thank you.
Thank you so much, Professor Servadei, Franco, dear friend Franco, for these kind words and for your encouragement. And I don't forget that you are the first one that contact me for being assistant to running for this first. So this is the proof that you are always promoting women in neurosurgery. Thank you so much. And thank you for everyone, for all the speakers, for all the moderator, and stay safe and take care in this hard time. Thank you so much for everyone. So bye-bye.
Bye, ciao.
Ciao.
Thank you. Bye-bye.
Bye-bye. Thank you. Thank you so much. Okay.